So just had a call to say there's a dog coming down, has been found strangled by a python. We don't know what kind of state it's in, so we just got to set up and prepare for the worst. So the normal injuries are rib fractures, compressed chest, so often the patients need oxygen, and sometimes we even need to intubate them if they can't breathe properly, because obviously with the strangulation they compress the chest. It can be really nasty, and obviously pain relief. We don't know exactly how big the dog is, but we know it's a small dog, so get some tubes ready and just be ready to intubate if we need to.
With the team now ready and on high alert, traumatised owner Jenny is rushing in with her badly injured 10-year-old Maltese, Roxy.
Okay, tell me a little bit about what happened.
And because she can't run away because of her back legs.
Yeah.
Jenny is still in shock after rescuing her beloved little dog, but she's still able to explain that Roxy has very limited mobility in her hind legs due to a previous spinal condition.
Hey, sweetie.
And had no way to escape from the dangerous snake.
We're going to take good care of her, okay? Yeah, okay, you pop out the front. I'm going to come and update you shortly, okay? Okay. My concern with this patient is her external wounds are obvious, but there could be a lot worse going on the inside. I'm surprised she's breathing as well as she is. She only looks like she's about 3 kilos, do you reckon?
I'm just going to give her half of that.
Yeah, cool, good idea. I've got a nice vein on this one. Okay, let's go. Good girl. Okay, sweetheart, let's try again. Got tape there, handy somewhere?
Yep.
All right, let's see if we can get this in.
Alex is giving the terrified little dog some much-needed pain relief as quickly as possible. When the painkillers start to take effect, Roxy is finally starting to be less agitated.
Oh, sweetheart. Do you want to get an idea of how bad these wounds are?
Before Alex can start investigating any possible internal injuries, she needs to treat the nasty bite wounds where the snake latched on to Roxy's neck.
Just want to see how bad these bite wounds are. Cannot imagine how terrified she must have been. And she can't get away because she can't walk properly on her back legs. Roxy's a tiny dog and a python's bite can be so powerful. I just want to see, there's a lot of blood coming from here and
As Alex investigates the severe bite on Roxy's neck, she's suddenly alarmed that the snake may have inflicted a fatal wound on its helpless little victim.
I'm not sure he's not actually lacerated the jugular.
All right, let's get you into the van and get you all checked out, buddy.
Mobile vet Alison and nurse Amber have just picked up a stray kitten that was found wandering the streets of Brisbane. They're now off to do some tests after noticing something seriously wrong with the young cat's eyes.
Oh, wow. Look at your eyes, buddy. Hey, what happened to you, little guy? I wonder if you can see it all. Hello.
So the first thing I thought of when I saw this cat is that it just does not look normal. You can see in its face, its eyelids look abnormal. The eyes are very, very small.
He might actually be completely blind.
Oh, this eye is so recessed in. So you can see that the eyelid is actually turned in. So he's got what we call entropion.
It's all right, Papa.
So the eyelashes are actually poking into the eye, which is quite uncomfortable. And that would be happening because we don't have the pressure of a normal size eyeball flicking those eyelids out.
Alison suspects the stray's abnormally small eyes may be a condition called microphthalmia.
He may have been born with this condition. We don't know anything about his background. Or, you know, he may have been exposed to some toxin or virus, or even his mother might have been exposed to that while he was in the uterus. So we're going to do a quick vision test, which is basically an obstacle course. Pop him on the floor and see how he negotiates objects.
Have a bit of a wonder?
It's definitely using his ears and his whiskers.
Very unsure.
Looking at him, it's quite obvious that he can't really see. He's bumping into things. He's really relying on his other senses, like feel and touch and hearing, to negotiate the objects in the room. He's going towards the sound of people's voice. So I'd say he has very, very little to no vision at all.
Hey Gerardo, we've got Boris here.
Hey, Boris.
He's got a bit of a painful problem down below.
Oh, whoa,
Can see.
whoa.
At the emergency hospital, French Bulldog Boris has a rather delicate problem.
The owners just noticed it sort of sticking out, so they're obviously really worried about what's going on and how we can try and fix him.
I'm worried for him.
I would be.
I feel for him.
It looks painful.
I'll take care of you, mate. I'll take care of you. Oh, that's got to be sore.
Ouch.
So what happened with Boris is that he got excited and his penis came out, but then it couldn't go back in because the skin rolled inwards, and now it's super swollen because it's been hanging out for so long. I'm going to give him some pain relief because that's definitely what he needs. Good boy. Hey, good boy, mate. Good boy.
Owner Merrin is understandably worried about his little mate.
I came in today with Boris, who has some issues. Started this morning, took him outside and saw the problem that he has. So we just went straight to the vet. Boris is about 8 months old. He's a fun little pup. Always gets into trouble, bit of a character. So hopefully he's not too much trouble after this.
Well, we got to put that back where it belongs. Hey, Boris.
Oh, he's got a deciduous canine, so he's definitely about 5.5 months. 6 months at most. Oh, we're purring.
In Brisbane, Alison is doing a full health check on a little stray.
You mustn't have got a lot of attention on the streets.
She's already discovered the shy cat is blind, possibly from birth.
We're going to have to give this guy a name.
He's pretty cute.
He's so cute.
What about, I was thinking, like, Rupert? I think
Rupert, that suits you.
I think it
Rupert,
does.
do you like your name? All right, let's have a look and see if you are a boy. I was told you were a boy, but let's have a look.
Hello. It's a bit invasive down there, isn't that?
You actually don't have any testicles down yet. At 5.5 months, you would expect the testicles to have dropped, but they haven't. So we've got to find out, where are they, or do they even exist?
The missing testicles are another sign of a possible birth defect.
See if I can feel if those testicles are in there. The other thing that it could be, but more rarely, is that they're actually ovaries. So even though he looks like a male on the outside, he may actually have ovaries instead of testicles that are in the abdomen, which is why I can't feel anything on the outside. It is very unusual for a cat to be an hermaphrodite, but seeing that there's other defects and other problems, it's quite a high possibility. Let's go and see where these things are, mister. You ready? All right, Danielle, this is Rupert. We just want to do an abdominal ultrasound today to look at testicles. Sure. We've actually got nothing that's dropped down there.
Good boy.
It must be in there somewhere. Okay, let's see if we've got testicles down closer to the scrotum. See if they're hiding there. Oh yeah, what's that? Must be that.
Testicle. I think we might have found the testicle.
So the good news is that we found testicles. They're actually quite low down. They're on their way out, so that's very good news. So we're definitely a boy. Well, Mr. Rupert, it's been a big day for you today. Hey, you've had a lot of tests done. You've been such a star patient. Hey, you've got that beautiful face. Who wouldn't love that face? My hope for him is that he gets adopted. I mean, his temperament is absolutely gorgeous, and we know that cats with the right care and the right home, when they're blind, can still do really, really well. Come on, let's get you something to eat. Off we go.
How's it going, Trace?
Oh, he's doing really good. He's settled down nicely now.
At the emergency hospital, Boris is in extreme pain due to an unusual problem.
The plan is we're going to do an anaesthetic and reduce the swelling and put the penis back to where it should be, we're going to desex him as well. So
Sounds like a great plan. Hey, Boris. He may not be keen on it, but I think it'll fix
we
this
won't tell him
problem.
that. So Boris coming through. Anaesthesias in any dogs which has a flattened face have a higher risk of complications because their airways are smaller and compromised, and it makes it harder for us to intubate them. Okay, Boris, off to sleep, mate. We'll fix you up. You'll feel better when you wake up, mate. Let's go. Okay, tube in. Good. Check that. It's a very delicate structure. Careful with these clippers. We may be able to just lift it through and pop it in. If we can do that, then once we do that... Oh. There's one thing we could try, and that is actually giving it a squeeze. It seems a little bit brutal, but there is an accumulation of blood in the tip of the penis, and if you squeeze it, what happens is the blood then goes away. So you can't do this when they're awake. And it's about 50% smaller. Okay, so I'm gonna pull up, okay, and if you could push it in, if we can. Go. Success. Look at that, we got it in. We have success. So next is castration time. Great. The hope is that that will reduce the amount of testosterone and hormones floating around and reduce the risk of that popping out again. Okay, making a cut. We've exteriorized one of the testicles. Now we're going to clamp through the vascular structures, and then we'll chop that one off. Okay, Tracy, that's one down.
Excellent. Nearly there.
Nearly there.
Nearly there, Boris.
Okay, that's 2 testicles out. Perfect. Okay. Let's have a look. So both of his testicles are out now, which hopefully reduces his male urges and reduces the risk of his penis getting stuck out.
2 hours later, Boris is fully awake, and it's time for Gerardo to check his handiwork.
You awake, mate? Oh, yes, you are. Wow, you want to go. You can't jump out, mate. Boris has recovered from his anaesthesia without any complications, and he's even trying to get up and walk out the door. Look at that. It's still in there. Good job. He's going to stay the night here because we want to make sure that he is 100% awake and alert and eating and drinking before he goes home. Have some rest. You go home tomorrow, okay? Okay.
In another part of the emergency hospital, Alex is desperately trying to save little Roxy after her horrified owner Jenny found her being strangled by a python.
It was horrible, you know. It was sort of like, oh my God, what am I going to do? You know, what's happening?
Amazingly, her breathing is actually pretty good. So she mustn't have got wrapped around her chest, but obviously bitten her around her neck.
Although Roxy was badly bitten by the snake during the attack, her jugular wasn't lacerated as Alex first feared.
She doesn't walk anyway on her back legs, so she must be permanently paralysed. And obviously the owner carries her around, so...
X-rays will show if any of Roxy's internal organs have been crushed by the powerful snake.
From here, Roxy's going to be transferred into intensive care, and the overnight team will take some X-rays to make sure there's no other injuries like rib fractures.
For now, the little dog will be closely monitored for any changes in her condition.
Oh, you're such a brave girl.
Good boy.
On an unusually wet day in Bondi,
Come on, gorgeous.
an even more unusual pet is arriving at Kate's Veterinary Hospital.
Hello, Hello, buddy.
Emma, son Wayne and granddaughter Maddie have brought in 9-month-old Callie for some rather delicate surgery.
It's a really interesting day in the vet clinic today. I've got a sheep and we're going to be removing his tail today. Oh, he's so friendly, you guys. So friendly.
Callie is our pet sheep. He is a beautiful boy. He's so friendly. He's like a dog. If you scratch his ears, his back leg comes up and he starts going like this. He is just beautiful, 1 in a million.
But Callie has had a tough start in life.
His mother died when he was born, and his twin brother, and they had to raise him on a bottle.
Okay.
When it came time for him to become a meat sheep, she couldn't do it.
Okay,
and her husband gave her a month to find a home.
Okay.
Which is when I came in.
Yeah.
So.
Kate's more used to cats and dogs, but she also knows a fair bit about pet sheep.
We need to remove Callie's tail today because this tail is a risk. It's a risk to Callie's health long term. We know that sheep with long tails can quite often get fly strike, particularly in the hot Australian summer. Fly strike is where flies start to lay eggs in the wool and around the bottom, and then essentially you get this really large mass of maggots around that back end. We try really hard to do these when they're little, because it's slightly less traumatic, but it is what it is. He's still a young sheep. He is going to be okay.
All right.
Maddie, are you going to stay?
Yeah.
Yeah. Normally, people don't really get a chance to see their own pets having surgery, but in this case, Maddie works here as a vet nurse, so of course she's going to stay today.
See you, darling. We're good.
I personally don't know too much about watching sheep surgery, but I've seen Kate do every other surgery and she does it beautifully, so I made sure that he was okay.
So you're going to induce and then pop him straight on the table?
Let's do that,
Let's do that.
That's as low as the table will go, and otherwise it'll be challenging.
Callie's going to go under a general anaesthetic, full pain relief, the whole works. I've asked my good friend Ash Allison down from SASH, and that is because he's a specialist in anaesthetics. Sheep have quite a few stomachs, and that means that the risk here is that Callie regurgitates when he's under anaesthetic.
1, 2, 3.
The chance of him sucking that fluid back into his lungs is very real. This is where the risk is.
So we've just got a call from an owner. She's worried about her dog Turbo's eyelids, so we'll go check it out.
In Sydney, Audrey is heading to meet Sammy, who's the proud mum of a boisterous 6-year-old Shar-Pei cross called Turbo.
Come on, big boy. Turbo's, we've had him since he was 8 weeks old and he's very much part of the family. Being a Shar-Pei crossbred, we knew that as a puppy he could have some issues with his eyes, and just monitoring it over the last few years, it just started to get a little bit worse and worse.
Hello, Turbo. Come on in.
Go.
Oh, my boy.
Come here.
How have you been? So Turbo is a mix of Shar-Pei and American Staffy. Shar-Peis have a lot of excess skin on their head and it rolls into the eyes. It's quite common to see entropium or eyelid problems in Shar-Peis. So you can see that eye is quite sore. It's watering quite a bit. Is it just a clear kind of discharge that's coming out? Yeah. How long's he been squinting it for?
Oh, probably 3 or 4 years it's been on and off, but just obviously maintenance every day, but it's getting to a point where he's uncomfortable and we want to try and get it sorted for him.
You can see that it's really sore. There's a lot of watery discharge there. And you can see his bottom eyelid is actually rolling completely into his eye. It's actually rubbing on his cornea and it just looks really red and sore in there.
You come in the house and he'll rub his head up against your leg or the bed or whatever he can find, just to try and ease some of the pain, I think. It does upset you as an owner. You don't want to see your dog in any pain, and it's just irritating him constantly. Like some days he has really good days, but then others you can tell that it irritates him so much that he just gets so upset. Good boy. You're all right.
All right, so his third eyelid's very red. There's a lot of inflammation there. I'm just looking at his cornea.
Good boy. You're all right.
Probably about 3 millimeters rolling in. Oh, I know, it's sore. Having an eyelid that rolls into your eye and all that spiky hair rubbing on the surface of your cornea is very uncomfortable. You can imagine when you have a hair in your eye how uncomfortable that is, so this is a lot worse than that. Sometimes they do grow out of it. The skin kind of stretches into the head, but unfortunately in Turbo's case it hasn't done that.
The bottom looks a bit swollen.
Yeah.
Audrey's worried Turbo's eye could be badly ulcerated or scarred, which could lead to blindness.
So the plan is today I'm going to take him to surgery. We'll give him a general anaesthetic, and what I'll do is I'll roll those eyelids away from his eyeball. So we'll just take a small slither of skin, push that back. He'll feel a lot better with that off.
Brilliant.
Get your eye sorted. Be an eye tuck.
A little bit concerned. Obviously, the poor thing's never been under anaesthetic before, so hopefully he comes out well from that. But I think he's in safe hands with Audrey. See you soon, mate.
We'll see you soon.
Bye-bye.
Bye, Mama.
Bye.
See you soon.
Bye. Bye.
At the emergency hospital ICU, it's been almost 24 hours since Roxy was attacked in her backyard by a python.
I'm surprised Roxy's coping as well as she is, but she is going to need pain relief and she's going to need antibiotics for some time.
Hey, you go and see your mum?
Roxy's traumatised owner Jenny is desperate to find out how her precious little dog is doing.
Good girl.
I'm really excited to reunite Roxy and Jenny. It's going to be such a special moment.
Got someone here to see you.
Oh, my little baby.
We might pop her down on the floor, okay? You can pop down here. Oh, good girl. Oh, Roxy, there we go. We got you. Good girl. It's your mum.
Hello, sweetie. Hello, little Roxy. Oh, you're a good little girl, aren't you? You've been in the wards.
Oh, yes. She's had a tough old time.
Roxy is one very lucky little girl. If Jenny hadn't been there, I don't think she would have made it.
So everyone's calling me a hero.
Oh, you are a hero.
I'm terrified of snakes.
Well, that's what makes it
and
so
when my
special.
daughter said, you know, grab something and just try and get the thing off her, and I just stuck that in. The broom handle went through, and I didn't know what I was doing, really, you know.
Just a mother trying to save a little girl.
And because of her legs, you know, she doesn't run, she can't get away.
Can't get away.
Well, you know, she wobbles and falls and that, you know, so I'm always very careful.
Took x-rays of Roxy, and what we were looking for, did she have any fractured ribs or anything like that, which is quite common, that it could have easily crushed her. So the fact that she hasn't got any fractures and she hasn't got any internal damage is pretty, it's a miracle. I mean, she's remarkable how, even with everything that's happened, she's really doing so well. And I mean, if she's eating and we can keep her comfortable, then, you know, we want to try to get her home to you. So
I don't mind if you think to keep her
for a bit longer.
For a bit longer,
she's
just
been
to
through
keep
so much.
an eye on her.
Yeah.
Because if anything happens, you know what to do.
Okay, let's see if she'll eat some chicken. Let's just see, it's a little bit warm there. Eat a bit of chicken? Ooh, that looks like someone who's interested in chicken.
She loves chicken.
Does she? I was hoping she would. I can see she's interested, but she just doesn't quite feel like it yet.
She's
just not quite ready.
Just a bit weak and thinking.
Yeah, and sometimes they feel a little bit sick, and even with the drugs, she's, you know, the pain relief she's had, sometimes it can make them just feel a bit funny in their tummy, and I think she's tired.
She's ready to go back.
And we'll get her back on her pain relief and everything like that. So, okay.
Bye, sweetie. Bye.
So see you tomorrow, Mum. All right, we'll see you tomorrow, okay? Yes. Okay. Come on, sweetheart, let's get you back to bed, darling.
Roxy's going to spend another night in the ICU, and hopefully by tomorrow her condition will have improved.
Hey, I saw your bed out. Hey, are you okay, sweetheart?
In Sydney, Audrey's bringing 6-year-old Turbo in for surgery to his right eye.
All right, we're here. This way, this way, this way, this way. It concerns me quite a bit that Turbo's had this eyelid problem for quite a while because it's been scratching on the surface of his eye. It's probably had, you know, scratching and ulceration there at some point in his life. It's a good idea that we correct it before there's any long-term damage. Hello. His eye's looking really sore at the moment. He's really closing it. It's very, very red. So I think once the surgery's done, he won't know himself. I know, good boy.
First, Audrey needs to make sure anxious Turbo is healthy enough for a general anaesthetic.
Good job, well done, good job.
Very good.
That's good blood flow. So we just check his liver and kidney are functioning okay so that he has a safe anaesthetic. What a good boy you are. Good job. That's all we needed. Everything looks normal. His kidney parameters, his liver parameters are all within normal range. So healthy, ready to go. Properly, bend your knees. Oh my goodness, you're heavier than you look. Ugh. So it's always really tricky to do any surgery around the eye because it's very, very delicate. So we're hoping to achieve with surgery to remove the excess skin on the eyelid and then just roll it out so that that hairy part of his eyelid is not actually rubbing on his eyeball. And you can actually see how red the eyeball is and how red the conjunctiva is because he's constantly having that eyelid edge rubbing. So effectively what we're doing is we're removing a crescent shape of skin, and when we suture the sides back together, it will roll that eyelid out. Let's have a play. So we want to be really careful that we don't remove too much eyelid because of course we can't reverse that. So you'd rather stick on the conservative side, remove less, and if we need to go in and do it again, we can always do that.
The delicate surgery will be just millimetres from Turbo's eye.
So I'm going to make a crescent incision.
We'll keep an eye on that because we don't want it getting too warm.
1, 2, 3.
At the Bondi Veterinary Hospital, Kate's about to perform tail surgery on pet sheep Callie.
Kato's removing all of the wool from the area and she's got to clip this tail. Callie is some kind of a mixed breed sheep. I can see that he's got some Dorper in him, but he's got a large amount of Merino in him. Trying to get dog or cat clippers through this wool is a really big task. These guys are woolly.
Kate will be under pressure to remove the exact amount of tail.
If we take this tail too short, these guys can get sunburnt down around their tails. So if you don't cover that bottom properly, it can be a real risk for them. We want to try and keep this general anaesthetic as short as we possibly can. Sheep are the trickiest of animals to put under a general anaesthetic. These guys can regurgitate at any time, they can get hypothermia, problems with their breathing, so many things can go wrong. And the longer that Callie is under general anaesthesia, the more risky it is. The first thing we need to do is cut the skin, and we need to make sure that we leave enough skin so that we can get this closed. So we need to cut a little bit lower to make a nice fold over that vertebral column. It's a lot bigger than a dog's tail, has a lot more blood vessels and a lot more bleeders. So when we cut, we need to make sure that we tie off or cauterize any of the little bleeders. All right, let's do it. Got one tail off. So now what we have to do is we're going to suture this up, and importantly, very neatly. Look at that. Covers his bottom perfectly. It looks quite cute, to be honest with you. I'm done. Good job.
I'm very happy with the job that's been done. He looks excellent. He looks a bit funny with a shaved bum, but yeah.
A new look Callie has been given pain relief and will be left to sleep before heading home with his family.
So I'm just making a little crescent incision to remove some of that excess eyelid.
In Sydney, Audrey is removing skin from Turbo's right eyelid that's been rubbing against the eyeball, causing him a lot of distress.
So the problem with leaving an entropium or an eyelid that rolls and scratches the surface of the eye is that you can get long-term damage. So as well as getting ulcers and scratches, you can actually get pigmentation or scarring that comes across the surface of the eye, and they can go blind. You can see that I've made like a moon-shaped incision. So if I remove that piece of skin, it's going to roll that eyelid out a bit for us. This is quite a painful condition. Maybe with time, Turbo's got used to the pain, which is quite sad for him. So I'm sure that when he wakes up from anaesthetic today, he's gonna feel like a completely different dog. All right, so there's that skin. It's the tiniest little slither.
The final step is closing up the incision.
So it's important that we use really, really thin, delicate sutures because it's near the eye and we don't want any of those ends poking into the eye either. So I like to call it microsurgery because everything is so small and delicate. Your needle's absolutely tiny. So these sutures are special, as well as being really fine and soft. They actually dissolve after a while, so we don't need to go in and try and take them out. It's such a delicate area, we don't really want to be doing that near the eye. So I don't think I actually need to remove anything from the top. Now that I've actually rolled out the bottom eyelid, it's sitting really nicely.
But Audrey still has a concern that the constant rubbing on Turbo's eye may have left irreversible damage.
Now before we wake him up, I just want to check that there's no ulcers or scratches on his eye. So I'm going to pop a stain in, then shine a UV light, and that will show up any scratches there. It all looks pretty good. I'm actually in a bit of shock that there are no scratches or ulcerations on the surface of his eye because it is uncomfortable. He's had that for a while, and he's also been rubbing his face on everything he can find because it's so itchy. All right, ready?
Yep.
1, 2, 3.
You're done.
No, don't eat the cord. Come on, stop that. It's the internet cord.
In Bondi, Callie the pet sheep is awake after his tail surgery and he's making himself at home.
He's well and truly ready to go. I'm going to send him home with his hay so on the way he can have a comfortable journey.
Owner Emma can't wait to take her boy home.
It's been very anxious. I've been texting Maddie continuously saying, is he under, is he asleep, how's it all going?
Hang on, this way, this way, this way. Come on.
I really am looking forward to seeing him. I just want to know myself that he's okay, and the minute he comes to me, I know that he'll be fine.
This will all grow back. Should look absolutely beautiful in the next couple of days.
Yes.
See you, buddy. See you later. See you later, alligator.
Kate's done an amazing job. It looks so good, and it's reassured us that we've made the right choice for his future.
Oh, I know.
In Sydney, 6-year-old Turbo has fully recovered from eye surgery.
Good boy. Come say hi to Iona. Come say hi. Good boy. I'm a little bit woozy. Turbo's heading home now. I think he's going to have so much of a better life. His eye's going to be so much more comfortable. He's going to be able to see well. I think Sammy's going to be very, very happy.
For Turbo's devoted owner Sammy, it's been an agonising few hours waiting to be reunited with her beloved boy.
Definitely keen to see him. I'm hoping that obviously he's got good eyesight, no pain anymore, and hopefully less inflammation, and yeah, happy dog.
Where's Mummy?
Hello. Look at you.
Look at his little tail going.
Hey, look at you.
He's got his lampshade on.
Yeah, massive.
Just to make sure he doesn't scratch his eye. But you want to show Mummy?
Look, hang on, slow down.
So I'm very happy with how the surgery went. I think that eyelid looks great.
Yeah.
The big test is going to be in the next couple of days when that swelling goes down, how that eyelid sits on his eyeball.
Yeah.
But I think it's going to look really good.
Look at you, you can see now.
I know,
Yes.
you can see now.
Hey, you can see.
Does it feel weird with nothing rubbing on your eye?
Probably will feel
I
very
know,
weird.
he's not used to it.
Hey.
All right, get him home.
Yes, thank you very much.
All right, thanks for being an angel,
Come
buddy.
on, come on. Good boy.
I'll see you in a couple of weeks.
Yes.
Bye, Turbo. Come on. See ya. Sammy was very happy to pick Turbo up, happy that he's bouncing again back to normal.
Come on.
But for sure, that eye feels a lot more comfortable. Everyone's happy.
Oh, come on. Come on.
On the Gold Coast, Alex can't believe how well little Roxy is recovering
Hello in there.
after a near-fatal attack by a python.
Nobody likes to be in hospital, do they? Oh, darling. Hey, but I think you're doing very well.
The ICU team tell me that Roxy is really kicking goals today. She's eating, she's bright and comfortable. I think she's ready to go home.
Oh, you're such a brave girl. Such a brave girl. Hey?
After astounding everyone with her miracle recovery, Roxy can now be returned to her very relieved owner, Jenny.
Look who I've got here.
Oh, look at you.
We'll pop her in a bed. Oh, that looks nice and cosy in there. Look at that. Good girl.
Roxy. Hello, sweetie pie.
Oh, look at her. She's so excited to see you. Is it good to see her again?
Oh, yeah.
Yeah?
Hey? Look at you.
You've missed her a bit?
Oh, I couldn't sleep last night.
Yeah. I'm sure you're going to be checking on her every 5 minutes.
Yes,
tonight.
just like having another baby again.
You are a brave little girl, hey?
Oh, definitely.
Well, let's get her home, I think. Let's go. Good girl. I gotcha. All right, let's get you home.
Tell you what, if I see that snake again and it gets one of my, I'll know exactly what to do.
Thank you ever so welcome. I'm really so glad she's okay.
Everything that you guys
You look after her, okay, and you look after yourself, all right? I've just popped out from work, so I'm going to head straight to Brooke's house now.
After a busy day, Alex now has time to answer an SOS from another vet, Brooke, who's away on holidays.
She's given me a call because her mum's worried about the family dog Polo.
Mum Susan is looking after 10-year-old Polo for Brooke and is worried because he has a bad case of diarrhoea.
He seems to be fretting or he's not eating 100%. When she goes away, things always happen. And I've been worried about him. He is part of our family. We just love him so much.
Think I'm in the right place?
I'm very grateful that Alex could come and see Polo. I just wasn't sure what to do. Hi, Alex. Come in.
So I hear this little guy's not been well.
No, he's not. He's not normal.
Okay, let's start by checking Polo over. Okay, mister, are you ready?
Let's do that for Alex.
Check up. Good boy. Good man. Do I get kisses? Thank you. You're okay. You're okay. Yeah, that sounds good. Okay, that's all fine there. Can I have a feel of your tummy? There we go. And so when did the diarrhoea start?
A couple of days ago.
Yeah, so just after Brooke left.
Yeah, that's
it's always the way, isn't it?
Yes. Brooke's done lots of tests on Polo, but we don't really know why he gets the diarrhoea.
Is he drinking okay?
Yeah, he seems to be.
Yeah, good. That's good. He's nice and comfortable in there. No vomiting, nothing like that?
No.
It's not nice to have diarrhoea, and if it does go on, he's likely to get dehydrated.
Okay.
So really happy with how he is on physical exam, and he's bright in himself. So it's really just a matter of us getting this diarrhoea back under control. So I reckon we get Brooke on the phone.
Sure.
And I'll talk her through a bit of a plan for him.
That'd be great. Thanks so much, Alex.
Hey, Brooke.
How's my little man doing?
He's good, actually. I feel a lot better now that I've seen him. He's bright, running around, jumping all over the place. But he's got this diarrhoea, and I can completely understand why your mum's worried about him, because it sounds like it's just constant.
So, we've done the fecal testing to rule out those parasites. He's had an ultrasound to make sure that there's nothing going on in his gut. We've done the CBC biochem. That's all come back clear. So really I'm at a loss as to what to do next.
So what I'm thinking is we get him back on the antibiotics because we know that Polo responds to that, but I've also got another idea for a yeast-based probiotic. And what I'm hoping it will do is to stop him relapsing. We'll stop the antibiotics and then, fingers crossed, he stays good. What do you reckon?
Fingers crossed, that sounds great.
Cool, let's do it. I've spoken to Brooke and we've got a plan for Polo, okay? So we're going to start him back on the antibiotics. We're going to also put him onto a probiotic to support his digestive health.
That's great.
Hey, is it dinner time, Polo? So what I want you to do is give Polo one of these capsules in the morning and one at night, okay? Break the capsule open and sprinkle the powder on his food. Yeah, it's nice and easy, okay?
Yes.
Perfect.
You want some dinner?
Dinner time. Hey, sit. Oh, what a good boy. You got all your dinner.
Good boy.
Okay, I think my work here is done.
That's great, Alex. Thank you.
Good boy, Polo.
Oh, look at you.
I'll pop her in a bit. Oh, that looks nice and cozy in there. Look at that.
Good news for little Roxy. The much-loved pet has fully recovered from that near-fatal encounter with a python.
Come on.
Big Turbo has also bounced back after his eye surgery.
Look at your eyes, buddy. Hey, what happened to you, little guy?
And it's the happiest ending of all for little blind cat Rupert.
Hi. Hi, Rupert. Where are you? Oh, there you are.
He had surgery to make his eyes more comfortable and found a very special new home at another vet practice.
He makes the perfect clinic cat. I can see him sitting there welcoming all the new patients, making them feel comfortable. He's got his own little cubby over there. From living on the street to now having this life of luxury, he's one pretty lucky kitty. And we're so happy he's found a great home.
And even better news, little Rupert's now been given a forever home by vet nurse Dana, who fell in love and adopted him after losing her own cat.
Hey Alex, this is little Rhea.
Oh,
she
hello,
was found frothing at the mouth at home.
Aren't you frothing at the mouth?
Yeah, so we think it might have been a toad.
Yeah, the toads are really out at the moment, so...
On the Gold Coast, Alex is instantly alarmed that 12-week-old Rottweiler Rhea may have been poisoned by a cane toad.
Hey, you are super cute. All right, we'll check you out. Good girl. Cane toads release a toxin that's highly dangerous to dogs. It's absorbed through the mucous membrane, so through the gums, and it can cause all sorts of really serious effects. Effects on the heart, it causes neurological signs, it can kill them. Just have a listen to her chest. Make sure that she hasn't got any signs that we see with toads, looking for just any changes in heart rate or if the rhythm sounds abnormal, but that sounds okay.
Rhea's owner Jermaine is terrified his new pup could be in serious danger.
Rhea's around 3 months old and she means everything to me. She started foaming in the mouth when I came into the lounge room, and which got me really, really worried. So I got my girlfriend to drive me here, and kind of in a rush.
Let's have a look at your gums. They might tell us whether...
It's a little one.
Oh, I know, you're a wriggler. Oh, I know. They do look a little bit red. At home, Rhea was frothing at the mouth. She's not doing that now, but she's definitely got a lot of saliva around her mouth, and she's also got some quite red gums. Now, these signs go hand in hand with a recent encounter with a toad. Oh, sweetheart. Oh, darling, it's okay. It's okay. You're nice and bright, which is good, but I think we might wash her mouth out.
Yeah,
because if she has had a toad, that toxin will be around her mouth, it'll be all sticky.
Yeah.
So the quicker we can remove that, the more she'll be out of danger. So we see a lot of cane toad poisonings in this part of the country. So it's a good reason for us to just not take any chances here. I think you might be a little bit lucky, but we're going to wash your mouth out anyway. Okay. All right. Oh, I know. Okay. It's okay. Doesn't taste nearly as bad as that horrible toad. Puppies in trouble just have a way of meeting each other, I think. This is by far the most effective way to remove anything irritant from the mouth with a cloth. People at home often make a mistake of getting a hose and putting a hose into their mouth. It's the worst thing you can do because you imagine they're in a bit of distress anyway, can take a whole heap of water down and even into their lungs. So it can be really, really dangerous. I'm going to remove all that nasty stuff in there. You all right? I feel like you're going to lose a finger.
Not me.
We've given Rhea a thorough check over and she seems fine. So now we get a little bit of puppy love.
Oh, is that the itchy spot? Is that the itchy spot?
You are too cute.
But before Alex has a chance for any more playtime, a second puppy is rushed in.
This is the second one, Alex.
What's
this
happened?
Is another one. We possibly have gotten to a toad as well. We're foaming at the mouth.
I'm just about to take Rhea back out to her owner when suddenly our receptionist, Amber, comes through the door with another puppy about the same age with the same signs. What's going on here? What's this little one's name?
Nova.
Nova? Come here, little Nova. Oh, sweetheart. You two naughty puppies, hey?
At the Australian Reptile Park, Tim needs to check on one of the vulnerable babies that needs constant care.
How are you? How was your night? Come here. How are you, mate? Good morning. He loves a cuddle.
Babies like Pipsqueak can deteriorate quickly, so round-the-clock monitoring is vital for their survival.
So he's just at the point where he needs to come off milk and have a 100% diet of leaf. I can see that you've eaten. You see these leaves here? Looks like a mower's been across the top. You want to get back on? Nah, I didn't think so. Oh, you are? What a big boy! What a big boy. Show me how you climb. Intervening with a joey is always a hard decision. We explore everything we can to keep a joey with mum because as much as we try, we will never be as good at rearing a joey as mum is. You sitting in your basket or up on the branch like a big boy? Pipsqueak has been hand-reared since he was tiny, and that was 5 or 6 milk bottles every day. His mum was 12 years old, and he couldn't stay with her. She wasn't producing milk. So look at this. Look at this. He's feeding now. Go on, you can do it. It's a big leaf. How about that? That's the good stuff. Go on. That's it. You hold it. Good boy. We are always raising little orphans. Devils, quolls, koalas, wombats, kangaroos, wallabies, possums. Oh, you still like your mates, do you? You still like your mates. That's a big cuddle. This is a comfort toy. So we spend 24 hours caring for them, but we're not with them every minute. So you add in little buddies. They smell good, but it becomes a real comfort, like a dummy to a baby. There you go, you can cuddle it. You're going to be out with the other koalas real soon. My morning rounds are filled with happiness and cuteness, and Pipsqueak is no exception.
Hales to Tim.
Go ahead, Hales.
Hey, just wondering if you can come up to Vet Block. I'd just like you to have a look at Frankie, the Kangaroo Island kangaroo.
Yeah, no problem. A couple of minutes, okay? See you, pal.
With Pipsqueak settled with his fluffy mate, Tim's received an SOS about another one of the park's vulnerable youngsters.
Hey, what's going on with Frankie?
Oh, she's a toe sucker.
Oh, no.
Yeah, she's sucking on her fingers right now. So
Yeah.
she usually sucks on her toes, I've just noticed.
Oh, yeah, look at the toes.
Yeah, it's just a bit concerning.
And at first you could think that toe sucking is cute, but they will strip the toe raw.
Hey, Frankie. You're sucking your toes. That's not good.
It can be fatal. I've lost animals through toe sucking and infection.
Cut that out.
Alrighty, let's go.
In Sydney, Audrey is worried about one of her regular patients.
Hey, Kate, we're here. Hello. Hi. How's my Santos boy? Hi. Hi, Santos. Hi. How have you been?
Santos isn't that typical Rottweiler that you imagine. He's not tough, even though he looks tough on the outside. He really is a big softie. He's more like a cat than anything else.
Let's go. Come on. Let's have a look at you.
Devoted owner Kate is concerned about changes in a lump on Santos's neck.
We had a look at it a few months ago and it's definitely increased in size since then, so.
You can feel a really large firm mass. It's almost this big and it has almost doubled in size. So I am quite concerned that it's growing so quickly and more so in the area that it is in. It's sitting quite close to his throat there. Do you notice that he's having any problems eating or drinking, any coughing or gagging?
So there's not much that stops him eating. He does sometimes cough when he drinks, but he's done that his whole life, so.
Yeah. So it is quite mobile. It's actually quite firm. I can wriggle it between my fingers, but it is sitting just sort of right here where it would be causing some discomfort. Do you find him uncomfortable? Does he seem bothered by it? No. Has his bark changed at all? No. But that's good. So the main sort of tricky points with his surgery would be where it's located, because it's sitting right on his windpipe, so we'll have to be careful there, and obviously the 2 large jugular veins on either side. So I think sooner rather than later for him.
Yeah, fair enough.
Jump on him.
I'm always worried when he goes under or if he goes in for surgery, obviously a family member, so yeah, it's always scary, especially given that he's getting a bit older now. But, obviously you've got to do it.
Bye, Santos. A little bit of a difficult surgery. With does invade those vessels, we're not going to be able to remove it at all.
Hey, Frankie.
So I've just noticed she's sucking on her toes.
At the Australian Reptile Park, Tim and curator Hayley are dealing with a seemingly simple but potentially fatal problem with 10-month-old kangaroo Frankie.
Sit still, Frankie.
Can't be that big a deal, right? I mean, kids suck their thumb.
Obvious. I mean, she's just starting to get an abrasion here.
Yeah.
Look at that. Is she doing it all the time?
Mostly when I'm not with her, as a comfort thing. I think when I'm not there.
Yeah. It seems extreme to say that toe sucking could be life-threatening, but I had a Joey that sucked so much it basically degloved its finger. The infection set in and I lost it.
Let's just pop out for a minute and have a watch, and then we might take her in and have a better look.
Sounds good.
Okay, stay there, Frankie.
Tim wants to see firsthand how serious Frankie's bad habit has become.
Oh, well, she's on her toes now. Well, that didn't take long.
Yeah.
Frankie had a bit of a nightmare scenario. Her mum Ollie developed mastitis, got an infection, and Frankie and mum Ollie had to be separated.
Hayley has been Frankie's surrogate mum 24/7.
I don't even think I know how many animals I've raised over the years. Frankie's just at that stage now where she's doing the old boxing kangaroo. But when you're trying to cook dinner and she's attached to your leg, boxing your leg, between the 3 kids and the kangaroo in the kitchen, it's time consuming.
So like you thought, the second you leave...
Starts comforting herself by sucking on her toes. I can't be with her constantly. In mum's pouch, she'd be suckling on the teat inside the pouch, or she'd be with mum, so it's comfort.
And how long's it been happening for?
Just the past few days I've noticed it, but you can see how much damage she's done to the toes just in those few days.
That's pretty obvious. That the second you leave, she's... Fretting.
And I think when I leave, she starts thinking, where's mum, where's mum? So she sucks the first thing in front of her face, which is either her toe or her finger, and that calms her and she thinks mum's with her.
Let's grab her, take her into the prep room and just have a bit of a look.
Come on, Frankie girl.
Tim now wants to do a closer examination of Frankie's damaged toes, hoping they've caught the problem before it's too late.
You're not going to believe this. This is Nova.
At the emergency hospital, Alex can't believe a second pup is now being rushed in with another case of suspected cane toad poisoning.
So this one's frothing at the mouth as well?
Yeah.
Okay, let's have a look at her. Okay.
Alex is just trying to work out if little Rhea is suffering any effects from the cane toad toxin.
Our second puppy is called Nova, and she's so cute. She's a Staffy cross, and when Rhea sees her, she's, "What are you doing here?" And there's an instant connection. There's a story here.
I hope they're going to be all right.
It turns out Nova's owner, Cooper, is housemates with Rhea's owner, Jermaine. Both boys suspect their young pups have got themselves into trouble.
We discovered that our dogs were like, I guess you could say, foaming a little bit under their mouth and just really lots of saliva just dripping everywhere all over the house. I was kind of confused, but big fella over here was pretty scared. I think he was, can we go to the vet? Can we go to the vet? We need to go to the vet.
So I think both of them might have had a toad.
Might have had access to a toad.
Yeah,
It happened right after they were outside in the rain.
Okay.
And they've come back showing the same symptoms.
Okay, we'll check them both out. But they're 2 different families?
Yeah,
just housemates?
Just housemates.
Housemates, okay. Well, what have you 2 been up to? You 2 naughty puppies, hey? These 2 are the best of mates. Their owners actually share a house. You guys know each other, hey? They probably led each other into trouble. If they found a cane toad, they would have thought it was a great game. Let's have a look at you, Nova. Yeah, a bit the same. Looks real slimy and see that? Yeah. Yep. It looks just a little bit redder than normal. Okay, sweetheart. Good girl. Nova's showing very similar signs. A lot of saliva around her mouth and those slightly red gums. I think they've both been a bad influence on each other. Can I swap over? Because we might do her mouthwash.
Alex now needs to wipe out Nova's mouth to remove any toxin.
She's going to get the same treatment with the dishcloth. This is what happens when you play with toads. You've got to deal with the consequences.
Dogs are fascinated by cane toads and they'll go over and investigate. If they chew them, lick them, put them in their mouth in any way, it can be fatal. So we're not taking any chances. In case she's been in contact with that toxin, we're going to make sure there's none left in her mouth.
Good girl, that's the way. Good girl.
In Sydney, Audrey and nurse Bree have arrived at the My Vet Animal Hospital for surgery on 8-year-old Santos.
Go towards Bree. Come on. Alrighty, let's go. Let's go. Let's go.
Come on, good boy.
Santos is a very, very heavy, strong boy. I don't know how Mum walks him. He's not cooperating. We're tired now. Ooh, come on. Come on, Santos. Good boy. You good boy. Just a little pinch. Thank you, sweetheart. That's it. That's all we needed. We've just taken blood from Santos, so it's really important before they go under general anaesthetic to check their liver and kidney function mainly. So that's running in the machine right now. When the results come back, we'll have a look and go from there.
Audrey has been monitoring a large mass in Santos's neck,
Let's go.
but she's concerned about its recent growth and wants to remove it to investigate further.
We brought Santos into the surgery room. We've just started to give him his general anaesthetic and he's getting nice and sleepy for us. The big job's going to get this heavy boy onto the surgery table. It's a big job, so it's 3 of us. Oh my gosh. So we're just going to get the table into a V shape so we can lie him on his back without him rolling over. He's so big. So it's a little bit of a play just to get him in the right position. All right. Just even your head's heavy, buddy. So we're just strapping his legs, so his front legs forward, just so that it doesn't flap over the surgical side around his neck. So a little bit of experimenting just to kind of keep his legs in a position. I'm thinking that this mass is huge and it's literally sitting right next to the jugular. So that whole thing there is the lump. What I'm quite nervous about is that jugular, and you can actually see it pulsating along here, is literally lying on top of it. Obviously, if we were to sever that or cut through that, Santos could potentially bleed to death. Very, very nervous. Okay. The pressure's definitely amped up on this surgery. It's gone from a quick, easy surgery to a more involved job. I've actually got another vet scrubbing in with me to help me hold, and hopefully everything will come away nicely. Got a few bleeders. So we've got the cautery going, so that's just burning off all the little vessels that are bleeding. They're not big vessels, they're just under the skin. Good job. It's really far down. So I'm just trying to go deep underneath the neck muscles because it actually sits a lot deeper than we thought. So it's actually sitting underneath the muscle layer. That makes things even more tricky because we've got to go between the muscle layers to get to it. And obviously look out for all those major structures like the windpipe, the jugular, the nerves. So it couldn't be really in a worse place. Oh my God.
Imagine having 2 of these in your backyard.
Oh, no. Double trouble.
You wouldn't be able to take your eyes off them. So cute though.
That's adorable.
On the Gold Coast, Alex and nurse Kate are treating puppies Rhea and Nova after the mischievous pair had a close encounter with a deadly cane toad.
So they've either both got into a toad or something else in the garden that's upset them. There's lots of other things in the garden that can make dogs froth at the mouth. We see a lot of cane toad poisonings in this part of the country. Most nights we'll have at least 1 or 2 cases.
Owners Jermaine and Cooper confirm regular sightings of the deadly toads.
Around the house, there's like toads near the bin. I was actually really, really worried.
We were both freaking out on the way here, that's for sure.
Jermaine is beginning to suspect his inquisitive puppy may have played a lead role in today's drama.
She's really playful and she's really nosy about everything. So probably licked the toad.
Aren't you just a cutie, hey? I could imagine you hunting out a toad. You look like just the type, hey? Don't you? Cheeky. Yeah. You can see these two are just the best of mates, and I'm sure one of them is the ringleader and the other one was just playing along. Who started it? Hey, who went first?
Who's the troublemaker?
I don't think we're going to give you back. I think we're going to keep you. You are too gorgeous.
So I go out to meet the owners. They're 2 teenage boys, but they are so worried about their puppies. It's a great relief to be able to tell them they're going to be fine.
Hello, here they are. The terrible 2. All right, might swap you guys out. Why you can have cuddles with you. Here you are. Nova.
Oh, you feel better. Yes, you do.
That's the good news is, guys, that they both seem fine at this stage. Certainly, any time they've got frothing around the mouth, we're always concerned about toads, which is why you brought them down. You just never know with something like that when it can be quite serious. But honestly, these 2 have just been so adorable. They've had so many cuddles in hospital. I can imagine they get up to a fair bit of mischief at home, do they?
Yes, especially this one here.
Yeah? You're the ringleader, are you? Are you the ringleader? I could believe it. I could believe it, hey?
Pretty much Nova doesn't do anything unless she does it first. So if she eats, then she wants to eat.
Yeah.
If she goes outside, she goes outside.
So pretty much all you do is keep Ria away from toads, and we're safe.
I think there's this moment when they both saw each other out the back in the treatment room when they were like, what are you doing here? So these 2 boys, they don't look old enough to be parents, but they obviously take their responsibility very seriously and they really love these puppies.
All right, thank you very much.
Thank you.
You're so welcome. I wish we had more cute puppies like you come down. See you guys, stay out of trouble.
See ya.
See ya. You're lucky, very lucky.
Jeez, that was a close one.
Yeah.
Just pop her up.
At the Australian Reptile Park, Tim and Hayley are about to inspect 10-month-old Frankie's damaged toes.
So this one is worse.
Yeah, so we're on the inside, grooming claw. Ah, yeah, well, she's already broken skin. And that's going to get infected real soon.
Separated from her mother, the fragile young Joey has been sucking her toes whenever surrogate mum Hayley leaves her side.
Hey, I can't be with you every second. You wouldn't think it was a big deal, but the slightest thing with a kangaroo and it just seems to plummet.
I mean, that's very swollen. Can you see the abrasion there?
Yeah.
Has she broken the skin?
Yeah, just in the crease.
I mean, and that whole toe should be furred.
Yeah.
Tim and Hayley know all too well that Joeys can quickly die from infection caused by sucking their toes.
Just look at the size difference there. And they're both swollen, but that's bordering becoming infected.
Yeah.
I've seen kangaroos in particular strip the skin off, back to flesh. And the bacteria in the mouth causes an infection really quickly. So we will overreact because it can end really badly. There's no pus?
No, not yet. I think we've got it early enough.
I think you've got it just in time.
It's okay, Frankie, we'll get it sorted.
Fortunately, Hayley has caught it early. But there's not an automatic remedy for toe suckers.
How are we going to treat it?
You know I've got some ideas. I've always got ideas. I've got a fair idea on what to do. It doesn't always work, but I'm hoping it will with Frankie.
What are you looking for?
I'm looking for a pretty little pair of girls' socks.
Tim always thinks outside the box. I don't think he's ever thought inside the box.
You like the polka dot or the pink?
No, plain. She's definitely plain. His ideas are a bit crazy, but don't tell him, but usually they work. Oh, Frankie, what's he doing to you?
And if we have to,
Do you like
we
those?
will do your hands too. So don't suck them. Number 2. Oh, what? Hey, hey, hey!
She doesn't like that one. It's okay, Frankie.
Hey, leave it alone! Leave it alone!
Pink socks today. Hilarious. It looks ridiculous. She just tried to rip it straight off her foot. But fingers crossed, but I think it's going to work.
Can't pull it off?
Nope.
Here.
It's good.
Tim now wants to make sure his unusual remedy actually works.
As long as she can't get to those toes for a little while and we break her out of that habit. So my idea was good.
Yes.
Was that tough to say?
It was hard.
There's only one way to test it, and that's to take Frankie out and have a look at her mobility. See whether she's totally distracted by the mittens or if she just gets on as usual.
Okay.
All right, come on, Frankie.
I think this might be more than a lipoma, huh?
Wow.
In Sydney, Audrey is trying to remove a huge lump that's growing in 8-year-old Rottweiler Santos's neck. It's positioned dangerously close to the windpipe.
There is literally another 5 vessels under here.
So these blood vessels all around the lump make me nervous because what it means is that the lump almost has its own blood supply. It's almost like another organ growing in Santos's neck. All right, so I've separated it all the way. It's under the bottom, yeah. So I've peeled it away from the trachea. So I'm just going around the bottom of it now. I'm thinking this looks more than just a lipoma. Wow. God, it is massive. So we'll just cut the lump away and hopefully Santos doesn't bleed too much. Oh, it's bleeding. Oh, mother. No, it might stop. It's still going. More. We're just about to cut the last attachment of this lump out. We've had a lot of trouble because down to the fine line there's been 4 vessels in the way and they're humongous. So a couple of bleeders. All right. There we go.
Amazing.
So this surgery has been very, very complicated. It's been a lot harder than I thought it was going to be. The lump was deeper, it was attached to a lot more things and just really hidden under muscle after muscle. So it's been a tricky surgery, but it's come away well in the end.
Hey buddy, what happened?
3 hours later, Santos is awake and ready to be reunited with anxious owner Kate.
Let's go see Mama. You ready? Hi, Mummy. So everything's gone really well. I'm really happy that we've removed it all and we'll send that off to the lab for testing. I guess the main thing is just make sure he leaves his sutures alone, no scratching or rubbing. You ready to go home? You ready to go home? Yeah. All right, well, I'll leave you two together and I'll see you in 2 weeks.
No worries.
All right,
Thank
see you,
you.
Santos. Be good.
Good boy. Come on. Let's go home. Come on. Good boy.
Righto, Frankie. Out you come.
At the Australian Reptile Park, Tim and Hayley are road testing Frankie's new protective footwear.
Show us what you got. You got your new shoes.
Socks work?
They're hoping the protective socks will deter the joey from toe sucking.
Come on, little one. So far, so good. No, not back in your bag. Not back in your bag.
She's embarrassed.
No, she's not. I don't have the slightest worry whether Frankie thinks this is a poor fashion statement. I'm interested in her health, not how she looks.
Come on, Frank. No one can see you.
Come on. Hatch up. There you go. Come on. Oh, she's not sure. The mittens are a serious cure. She may need them for weeks a month. There will come a natural time when she will grow out of the desire to suck toes. Frankie, come for a little run. Here, come on. Back this way, back this way. Oh, you did well. In you go. Hey, you missed. There you go, sweetie.
She did good.
To provide a further distraction, Tim has another accessory for little Frankie.
My idea. It's pretty high tech. Let's give her a dummy.
I like it.
Happy?
Yeah.
Let's see.
She will be.
I think if she does this, she'll take it straight away. But she's going to drop it, and that's going to be a problem for you at midnight because, like a little kid, she's not going to know where her dummy is. So I think that if we just go with a little bulldog clip, try that.
Look at that. Now she can't spit the dummy.
She can't spit the dummy. Okay, we happy?
She looks happy. It'd just be like being back in Mum's pouch, Frankie.
Okay. Watching babies of anything grow up is spectacular. They're very cute, but you've also intervened to save a life. That, for me, is the good stuff.
Good girl, Frankie.
Pretty pleased at my handiwork. What do you think, Frankie?
Going on a bit of an adventure today to see a very special lady and her 4-legged companion.
Come on, Zenkai.
Gerardo's visiting his adored mum Minda to check on her elderly dog Zenkai.
Yeah, your mum's pet.
Okay, don't get. You go in there, Zenkai.
Zenkai is giving Gerardo a very rowdy reception.
Hey, Mama.
How are you?
Hey, it's good to see
Good
you.
to see you.
That is exactly what I want to see because that means that Zenkai is doing his job. So Zenkai is there, barking out aloud, alarming Mum, letting her know that someone's coming up the steps.
Come in.
Here's barky Zenkai. How's Zenkai going?
He's good. He's a very affectionate boy. Wherever I go, he's always with me.
He's like your shadow, hey?
Yes, yes.
Doesn't let you go anywhere without him. You taking care of Mummy? Is that what you're doing?
Yeah, he just like to be pat.
Hey, is that what you like? Is that what you like, hey? Hey, you been a good guard dog?
Yes.
How old's he now, Mum?
11 years.
11 years, hey? Does he still like going to the beach?
Yes.
These days, Zenkai is getting a bit slower.
Come on, Zenkai, let's go. He's like, where are you going? Do I get to come too?
So Gerardo wants to make sure his mum's precious elderly dog stays as healthy as possible.
Come, mate, this is the water.
Let's go in the
Time
water.
to swim.
Water.
It's your favourite place. Zenkai is about 11 years old, and that's getting pretty old for a cattle dog. So one of my big concerns is whether or not he is able to get out, run around, and protect Mum. Oh, there he is. So loyal to you. He always comes back to you, Mum, hey?
Oh, yes.
Knowing that Zenkai is there and basically follows her around like a shadow makes me feel so much more comfortable, because if it wasn't for Zenkai, I wouldn't feel comfortable at all that my mum lives by herself out of town.
You good boy, aren't you? He's a good dog. He's protecting me. Anything noise, he barks.
He's like a little guard dog, alarm dog, patrol dog.
Yeah, he is. He is everything. He's everything. I love him so much. Yeah, I don't know what to do without him.
So we can continue to patrol and protect you out here. There's a product that I think we should start Zenkai on. And it's got all the things that he needs to keep his joints nice and healthy, so he's comfy. They can get joint problems now that he's getting older. He's like 11 years old. So he's doing pretty good at the moment, but we want to make sure that his joints continue to stay healthy. There you go, 2 of those.
You want one, Zenkai? Yum. Come on. Oh, he loves it.
He's salivating, he loves it so much.
One more?
So 2 every day for 4 weeks, and then 1 every day thereafter. So it's a daily dosage, because if he wants to go for a walk because his joints feel like that, he does have no pain in them, it means that he gets you out of the house too, gets you walking around, which is important as well. So he loved those 2, didn't he?
He loves it.
Hey, hey.
Thank you. You good boy, aren't you?
Hi, Santos. Come on in.
It's been 2 weeks since Audrey removed a large mass from Rottweiler Santos's neck.
Good boy. I'm quite happy with how that's healing. There's pretty much no redness. That's healed really nicely. So
Santos's test results are back, and the news isn't good.
it's come back as a thyroid carcinoma, which is quite a rare tumour actually. I think it's about less than 2% of tumours in dogs are thyroid carcinomas, and it is quite a nasty one in terms of the way it behaves and how it spreads. What we need to be careful of is whether there's been any spread. So what I plan to do today with him, take the stitches out, do some chest x-rays on him, make sure there's no spread into the lungs there, and also have a feel of all his lymph nodes and make sure they're not big or enlarged in any way. All right, so we'll get started. So you can wait in the waiting room or go for a walk, and then I'll pop back out when the results come through. I'll take some blood, do those chest x-rays now.
I'm very worried. Yeah, he's my little baby. I'd be so upset. The house would be way too quiet without him, so he'd better come home, he better be all right.
Here we go, this way, this way, this way. This way, Santos, come on. Good boy.
Little tickle, little tickle.
Such a brave boy.
Such a good boy, Santos.
After taking out Santos's stitches, Audrey is running bloods to check his thyroid levels, which may have been affected by this type of nasty tumour.
So we're still within normal limits, so I'm pretty happy with that, but it is a low normal, so sitting at about 18. So far, so good. No need to start any meds.
Oh, great.
Next step is going to be the scary part. These types of tumours like to go into the chest, so they generally spread into the lungs first. So that x-ray is going to be really important to check that that's all clear, fingers crossed. X-rays.
little one. So this is a little stray. Quite unusual.
Yeah.
It's a Devon Rex, is it?
Yeah, it looks like a Devon. You don't normally see stray Devon Rexes. They don't normally go too far from home.
Hey, beautiful.
At the emergency hospital, Alex's next case has just been brought in after being rescued by Good Samaritan Elisa.
There was this cat roaming around Maltese East area for a couple of months, and we noticed it pretty much at night time coming to the house and looking for food. You could tell, and you had a good gut feeling that it had been neglected. And my partner grabbed her and we put her in the car and came here.
It's okay. Hey, you're in a little bit of rough condition, aren't you? Maybe he has been on the streets for a little bit. Could be. The fur's not feeling like too silky like it usually would.
And actually this big belly, this doesn't feel like food, this feels like worms.
Oh dear.
This poor little guy, it's impossible to say how long he's been on the streets, but I'd say it's been a while. His coat's not good and I don't like the feel of his tummy.
I know, you're so brave.
You're brave kid.
He's just worried.
Yeah. Stray animals can be quite agitated when they're found. The concern is always the reason for their tense behaviour, and we just don't know what he's been through. Just want to look at his gums. If he's got worms, it's possible it could be something like hookworm.
Okay,
Sweet. In which case, I want to make sure he's not too pale or anything like that. His colour's quite pink, which is good. But yeah, I think certainly flea treatment and worming treatment would be on the cards, but definitely he's lively enough. Well, let's see if he's got a microchip.
Yeah, absolutely. We'll give him a scan. Are you all right to hold on for a second?
Yep. Come here, little man.
Gonna hang out?
If this little guy is a Devon Rex, they're quite a unique breed of cat and pretty valuable. I'm sure he's got an owner out there that's missing him, so I'm hoping he's microchipped and we can reunite him with his family. You got the chip scanner?
Got the chip scanner. Right, cross all fingers and toes. Hey, let me say hello. Yay, that's a good sound.
Got a chip.
Got a chip.
Awesome.
Fantastic. So we'll track that on the system and try and find that owners like that.
Yep.
In the meantime, we'll get you into a comfy bed, hey?
Yep. Yeah. Here you go, mate.
We've scanned the microchip and we've managed to locate some details. So it looks like the little one's name is Spartacus. He's a male Devon Rex, so that matches the details of the cat. So that's really good news. So we can give the owners a ring now.
Hi, is that Susie? Hi, Susie. It's Dr. Alex Hines here from the Animal Emergency Service. Do you have a cat called Spartacus? You did? Okay, so he went missing? How? 18 months ago. So she's very emotional. She had assumed that she would never see him again, but she's on her way down here, and I can already tell this is going to be a very emotional reunion.
Hey, Spartacus.
You ready to see your family?
In Sydney,
X-rays.
Audrey and Nurse Bree are x-raying 8-year-old Santos after he had a large lump removed.
Both that area looks quite good. Don't see any masses or fluffy masses. Everything looks great. The heart looks great.
Really good.
That's good news. Now you got to call Mum. I got to call Mum. Yeah.
Owner Kate has been waiting anxiously for the results.
He's a good boy. Do you want to come in and have a look? Yeah. The good news is, and I'm really, really happy, the x-rays have come back clear. There aren't any signs of masses or lumps or bumps in there. So that is really good news.
Yeah.
The other thing is his bloods came back really good as well. So his thyroid level is actually within normal limits.
Yeah.
It is sitting a little bit on the lower end, but still normal. So we'll just check in on it maybe every month.
He gave us all a heart attack.
Oh, yes.
Very good news. They got it all. There's no signs of anything else. And yeah, they reckon that he could potentially be cancer-free for the rest of his life. So really excited about that. That's such a relief.
Hey, Spartacus.
You ready to see your family?
At the emergency hospital, it turns out to be a very special day for Alex. She's about to reunite a cat that's been missing for 18 months with his overjoyed family.
I've actually got goosebumps. I can only imagine how excited Spartacus' family is going to be to see him. 18 months missing, and now he's suddenly turned up. Hey Susie, hey Craig.
You done?
Good, I'm Dr. Alex. I've got a special little friend here for you. Hey.
Look who this is. I haven't seen him for so long.
You know, it's not always about the surgeries and the medicine. Sometimes it's as simple as putting families back together.
Look, he's all curly now. Oh, yeah. He's got more curl.
You must have thought you would never see him again.
He's been missing for like 18 months.
Wow.
I haven't seen him for that long.
Yeah. Yeah, you must have thought.
I knew he wasn't passed away. I knew that he was stolen.
Yeah.
And then Trudy, the breeder, rang me this morning and said the Spartacus be found.
Yeah, he's a very precious boy. Sometimes think if he could talk and tell you what he's been up to, you know? These are the moments that make me so glad I'm a vet. You take him home, give him lots of cuddles. He's been gone for this period of time, but he's got the rest of his life with you.
All right, here we go. This way, this way, this way.
Big Santos has recovered well from his surgery, with no signs of a return of that nasty lump on his neck.
That's the news. I don't think we're going to give you back.
And the two mischievous puppies that had a close encounter with a deadly cane toad have been on their best behaviour.
I hope they're going to be all right.
And now play with each other instead of the local wildlife.
The good news is, guys, that they both seem fine.
Hey, Trace.
Hi, Alex.
Who's this?
This is Ellie.
Hey, sweetheart.
Ellie's been retching for like 24 hours.
Okay.
And Mum's extremely worried about her.
On the Gold Coast, unwell little rescue cat Allie has been brought in to Alex.
Hello, sweetheart. You're a beautiful girl.
Allie's owner Shirley is a keen sower. And when her precious Allie started suddenly dry retching, she instantly became alarmed that the curious cat may have swallowed a needle or thread.
Has she ever done anything like this before?
No, she hasn't. No.
She's been pretty healthy up to now?
Has. She could have snuck in there and got a bit of cotton, maybe.
Okay.
I thought, oh, she'd be right in the morning, but no, she was doing it all during the night.
So we've got to find out.
It's just not like her.
Yeah. We'll take really good care of Ellie. I'll let you know as soon as we find anything.
Okay, that's great.
Okay.
Thanks a lot.
What I'm worried about with Ellie, she may have swallowed a bit of thread or needle and it's now got stuck. And if it is something like that, we need to find out pretty quickly. Okay, let's have you out and we'll check you over. I know you're a bit worried. Okay.
Allie is agitated, which is making it tricky for Alex to do a full examination.
Come on, sweetheart. Are you all right? I can tell that she's quite nervous, so we're going to need to go really slowly with this little girl. Oh, can I have a look? Oh, good girl. Okay, well, I can't see anything obvious there. Feel around her neck. So when she's retching, you know, she could be trying to bring something up.
Or maybe it's just stuck in the back of her tongue.
Yeah. Listen to her chest as well. Hey, Ellie, good girl. Good girl. Cats do not like being in hospital as a rule. It's noisy, there's dogs barking, and it just makes them very uncomfortable. I think she's getting the limit of what she's going to put up with, hey?
Yeah.
She's getting a little bit stressed out, so I'm going to give her some sedation and then we'll pop her in a bed and let her settle down for a bit. This will just relax you a little bit.
If Allie has swallowed a needle, Alex needs to find it quickly, but she'll have to wait until the scared little cat is more relaxed.
Good girl. There you go. Good girl.
In Sydney, Kate's on a rescue mission.
I'm going to see Axel, the 8-month-old boxer who is driving his parents absolutely mad.
Jess and Jerome live in a ground floor apartment with their 4 kids and a very boisterous and noisy boxer called Axel.
Knock, knock.
Ah,
Hello.
Dr. Kate.
How are you?
Good, come on in.
Hi, beautiful boy.
Down.
Hello.
Good boy.
Come on. Oh, he's looking beautiful, you guys.
Oh, we love him.
Do you love cuddles? You do love cuddles. I have known Axel his whole 8-month life, and he is absolutely beautiful. But he is driving Jess and Jerome absolutely up the wall. So you guys have called me for a very specific reason.
Yes, barking. Barking when we don't pay him any attention.
Okay.
As soon as we talk to each other or we watch TV and we don't pay him the attention, then barking. Down, Axel. He's our first dog that's ever graduated from puppy school, so we were really proud of that. But after that, it's like, how do you train your dog to make sure that they don't do things that are annoying, like barking? We live in an apartment block, so we have to be mindful of everyone else, and we hate for him to bark.
Yes, that's something that is going to cause these neighbours to complain.
Down, Axel.
May even result in them having to rehome or actually get rid of Axel. And what happens when you ignore him? Because I presume that you've tried that.
It just gets worse.
Okay.
We end up either taking him out for a walk or giving in to him and giving him something.
All 4 of my children know he's my favourite child. We just love him, but we have to do something. We just need to stop it.
He is like a 2-year-old child.
Exactly.
He is like, everyone pay attention to me at all times. It's out of control. They can't continue as they are. We have to figure out a solution for them.
Down, Axel. Down, baby.
In Sydney, Audrey is on her way to check on Minnie, a very special companion cat.
Hi Charlize, how are you?
Hello, I'm well.
Hello,
She's-
Minnie.
she's all ready.
Here she is. Thanks for popping her in the carrier.
That's okay.
So Charlize is the main carer for the owner, Andrew. And he's quite sick. He's got MS.
There you are.
This cat means the world to him, so she's called us in to have a look.
She just lays on his bed and keeps him company.
You're his main companion, aren't you?
Yeah. Minnie's a beautiful stray. She just wandered in and jumped on his bed, and they got along like a house on fire, and they do things together. She's such a beautiful cat, and she's so affectionate.
She is, isn't she? And he'd love her very much.
Oh, he does. He had a dog, and that died around 8 years ago. And he went downhill quite fast. He was really depressed. And then when she came along 4 years ago, he started picking up and being jovial and laughing and joking. And
Power of animals, huh?
Yeah.
All right, Miss Minnie, let's have a look. Oh, that does look pretty nasty. It's quite big.
It is. It's gotten bigger in the last few months.
Yes.
And we thought maybe she had been in a fight and been scratched, and it had been infected and never really healed.
I see Minnie for the first time and I'm quite shocked with how that looked. It looks more than just a wound. It actually looks like a mass that's ulcerated, so a lot more serious than I thought. What I'm concerned about is that it's growing quite quickly,
Yes,
especially
it is.
the last couple of months, and that it's looking quite red and raw. So it does look aggressive or quite fast growing. So it could be a malignant tumour that we need to get off quite quickly.
Charlize fears the worst if 16-year-old Minnie's tumour is beyond treatment.
If Minnie goes, then Andrew goes downhill. He doesn't want to get disappointed again or lose another animal.
From here, I'm going to take Minnie into our partner hospital.
Oh, darling.
We'll go ahead, take the lump off. The best case scenario is that there's no signs of internal spread, that we've got it early enough. We'll look after her. Worst case scenario is we won't be able to operate, and eventually Minnie will probably die.
I love you, darling. It's all right.
Down.
In Sydney, Kate's answering a distress call from the owners of a dog that never stops barking.
Down, Axel.
I'm going to get you guys on the couch. I'm going to get you pretend to watch TV like you would at night. And I'm going to sneak around the corner and see what he actually does.
Okay.
Kate wants to see for herself Axel's behaviour when he's not the centre of attention.
Axel, down. Axel, down. Down, baby. No. Axel, no.
This is out of control. They live in an apartment building. They can't have this continue on.
Why are you barking?
It's not a good boy. Not a good boy. You get all the attention. My biggest fear that we have to get rid of him, and that's just not an option. It's like saying get rid of one of your kids. Axel.
It doesn't take Kate long to work out why Axel is so needy.
Yes. No.
He's relying on you guys to entertain him, and he doesn't like that you two are interacting and ignoring him. And exactly what he's saying is, I'm bored.
Yeah.
He's saying, bored, bored, bored. I'm bored. I want you guys to entertain me. Boxers are absolutely lovely dogs. They're one of my favourite breeds, but these guys are absolutely high energy.
We can throw a ball forever, come home, we're tired, we'd want to sit down, have dinner or watch some TV, and it's just, what's next?
But we can't have that go on for 2 or 3 years. And it's not going to get better unless we address it. This is not something that Axel is going to outgrow. And that's one of the common misconceptions about this, is that they think, you know what, he's just a puppy. The reality is if we don't fix this now and we don't get on top of this now, he's going to end up at 2 or 3 with exactly the same problem, if not worse.
Look at you. Hey, Ellie. Come on, sweetie.
On the Gold Coast, Alex urgently wants to find out if 5-year-old Ellie has swallowed one of her owner's sewing needles.
Hey, little girl. Just a little sleep, okay? There we go. That's better.
Ellie has been vomiting and retching for 24 hours.
Not a lot of room down there. It does look a bit red on the roof of her mouth there. I'm just having a look down Ellie's throat at the moment, and it all looks pretty normal. Definitely no string under her tongue, no thread under there. Sometimes the thread can get caught under, but that all looks fine. It's not uncommon to see a bit of grass under there, but there's nothing there.
Ellie's owner Shirley is devoted to her precious little rescue cat.
She's a friend, somebody to talk to when you're by yourself. She meows and talks to me in her own way. She means a lot to me.
I might put that somewhere for safekeeping. The next thing now is to take her through to X-ray. If Ellie has swallowed any metal, like a needle or a pin, it'll show up as clear as day. I'm going to get you sorted out and get you home to your mum. But if it's stuck somewhere in her throat, it could cause major trauma.
We'll just get started and take bloods now.
Yeah, good idea.
In Sydney, Audrey is about to perform urgent surgery on 16-year-old Minnie to remove a potentially deadly tumour on her face.
It's a nasty looking lump. It actually looks quite aggressive. It's ulcerated on the outside. It's grown quite fast. So I'm quite worried. So it's really important to screen her internal organ function. I just want to make sure that's all good for anaesthetic and also that there's no spread anywhere. Good girl. A good girl you are.
Blood tests will determine whether elderly Minnie is fit enough for surgery.
Let's check those bloods, shall we? Yeah, let's take a look. Oh, that looks great, actually. So her kidney function's all within normal limits. Liver function all looks great. So if all looks good, we'll go ahead and do the X-ray. Check her chest, check her heart, make sure there's no spread there.
A little bit more.
X-rays will give a more definitive view of whether the tumour has spread to Minnie's internal organs.
Okay, X-rays.
Yeah.
So we're having a look at one view of the chest for any masses or anything unusual that might indicate a spread of a tumour into there. And it's looking nice and clear. So that's great news. It means we can go ahead with surgery.
Time for your big procedure, okay? Here we go, sweetheart.
On the Gold Coast, Alex is X-raying rescue cat Allie to find out if she swallowed something that could have caused a mysterious bout of dry retching.
We really want to get everything from right at the top back of her throat right down to her stomach, really.
Allie's owner is afraid her little girl may have swallowed a sewing needle.
If Ellie has swallowed any metal, like a needle or a pin, it'll show up as clear as day. You ready? I can see a microchip there, and I'm really looking for something along here that looks like a needle in her throat. Yeah, that looks okay. That's good. That's good, Ellie. You haven't been eating any needles by the look of it. It's good news. There's no sign of any metal object either in her throat or in her stomach. It doesn't really explain why she's
doing this retching. The mystery of Ellie continues, so I'm going to take her back out to the treatment room. Just get her back here. Good girl.
With a sewing needle ruled out, Alex is now starting to suspect another possible reason for Ellie's dry retching.
So we haven't found anything, and it makes me a little bit concerned about the possibility of a tick. Tick paralysis is really common in this part of the world, and if Ellie has got a paralysis tick there and we don't find it, then that could be fatal. That retching is a sign that her throat's becoming paralysed. The only way we're going to be sure that there's not a tick there is to clip all the hair off. It's just too risky.
Alex wants to make absolutely sure a deadly tick hasn't burrowed deep into Ellie's fur.
Oh, it's all coming off, Ellie. We've finished clipping all of Ellie's hair off. She looks like a very different cat. No tick, so that's good. So I reckon let's get her back to bed. Come on, beautiful girl. I'm relieved there's not a tick, but the mystery with Ellie continues.
Hey? Are you waking up?
I'm going to let her rest now and come back and check on her in the morning.
Good girl. All right, you ready for your anaesthetic?
In Sydney, Audrey is operating on 16-year-old Minnie to remove a suspected malignant tumour from her face.
All right, I've just put heaps of ointment in that.
Yeah, great.
It's an anxious time for Minnie's bedridden owner Andrew and his carer Charlize.
And it's a big day for Andrew because he's scared that her eye's going to be taken out. Very upsetting, but he's been reassured that she's in good hands.
She seems quite stable, so heart's good, breathing's good. I know how much Minnie means to her dad, Andrew, and you know how important it is that this goes successfully. So there's a bit of stress there, but I'm confident that we'll do a good job. So I'm clipping Minnie's hair away, and I'm starting to get a little bit more concerned than I was previously, only because now I can see how big that lump really is. Right on the border of the eyelid margin. We don't want to obviously take away her eyelid, so it's a lot closer and a lot bigger than we thought initially, which means that we don't have a lot of skin to play with. Hopefully we get all those nasty cells out. I am quite worried that I can't take as much margins around the eyelid because it's really right by the eye. So we can only do the best we can and just take as much as we can to close up and then hope that we've got it all. So we've got that off. That's the big lump. Let's send it to the lab. See what you are. So the lump's off, and now's the next big hurdle, which is trying to close up that defect, make sure that we've got enough skin to close without changing the eyelid shape. Well, that's coming together nicely. It is a bit like plastic surgery. I'm trying to just suture this closed without it lifting up her eyelid. As much as it is about getting this lump off and finding out what it is, it's really important to me, and I guess the owner as well, that we return the cat looking as much as we can normal. It's already quite a big surgery. There's going to be stitches in its face. So I just want Minnie to look as good as possible. Okay. All done? Yeah, done. Let's see how that eye is looking. All right, there's obviously a bit of swelling. So once that swelling goes down, I'm hoping that that eyelid will actually sit pretty well. I didn't have to push it up too much, and I actually managed to drag some skin from further up in her head down. So I think that will heal really well. And I guess the big test is in about 10 or 14 days when we take the stitches out, how it looks. But pretty happy.
It will be an anxious wait for the test results to find out if there are any cancerous cells in the sample.
Removing the lump is one part of it. Whether those cells have started to go into the body or seed into the bloodstream, we'll never really know, but it looks like we probably got it in time. Okay. Ready to go home?
His name is Buster.
What's going on with Buster?
So they've reported that he's struggling to breathe as well.
At the emergency hospital, elderly Buster has been rushed into Gerardo.
Oh, I can hear it.
Yeah.
He's having difficulty here. Can you hear that?
Yeah.
Yeah. Anytime a dog is brought down to us and presents with breathing like this, my number one concern is upper airway obstruction. This is not good. His airways are closing over. It sounds terrible. His breaths are like... Okay, we need some sedation. That will reduce his stress. Can you give him some oxygen, please? Here we go. Sure. I'll give you a mask. The causes of upper airway obstruction could be anything from foreign body, like something stuck at the back of the throat, to swelling potentially caused by cancer, or even paralysis of the upper airways. It can be caused by a deadly paralysis tick. We have to give him some sedation quick because his airways kind of closed over, and the sedation will settle down his breathing and make it easier for him to breathe through his closed airways. Okay, here we go, mate.
Good boy, brave boy.
Oh, you're a superstar. Okay, there we go. Is he chilling out?
Yeah.
Oh, that's much better. The sedation's kicked in and we bought ourselves a bit of time. Now we can have a look to see what could be causing the airway narrowing. Okay, I'm gonna have a squeeze down his mouth. Good boy, Buster. There's nothing down the back there. It's like as if he's got paralysis of his upper airways, so let's check him over for a tick.
The deadly venom from a paralysis tick can rapidly result in an animal being unable to breathe.
I don't think he has a tick. I don't think he has swelling that could close his airways. So my concern then is that he's got, like laryngeal paralysis or something like that. What I'm concerned about now is something called laryngeal paralysis. This is common in older dogs, and it's where their upper airways start to collapse in when they breathe in. This can be life-threatening as it can result in them being unable to breathe.
Good boy.
If this goes on for 2 or 3 years, you guys are going to get kicked out of the apartment building.
Oh, for sure.
Yeah.
In Sydney, it's time for Kate to reveal her solution to stop young boxer Axel's constant barking.
I'll wait for you. Show us how you can do a good sit. Excellent behaviour. Yes. Boxers are high energy. They need lots of walking, lots of activity, but they also need a lot of mental stimulation. We've got to teach him how to play by himself without relying on you guys. So there's heaps of puzzle games for dogs. We've got a little activity ball, right, which we load with treats, and then he has to actually figure out how to actually get the treats out.
Oh, nice.
There you go. Try that. He's going to spend hours playing with this rather than annoying you guys.
Oh, you got it.
These little brain activities and these little puzzles are twofold. So not only are they keeping him entertained, so these guys can sit on the couch and not have him in their faces, but it's also meaning that he's getting tired by using his brain.
What's in there?
Oh. What I want you to do is put all of his regular food in one of these instead of him getting dinner.
He is so focused on that toy. His paws are working. You can actually almost smell his brain working.
So the final part of this is rewarding calm behaviour. Perfect. It's exactly where he's supposed to be. This is the perfect behaviour. This is what we're trying to get him to do. We want him to get to a point that he can relax on his own. It looks like it's a treat for nothing, but it's not. It's reinforcing just that he needs to be calm, allowing him to teach himself how to self-soothe.
Amazing.
Perfect boxer behaviour. This is the way that people should engage with their dogs all the time.
He's not barking.
It's not barking.
So beautiful.
Wow.
Yeah, you can do it.
You're a good boy. Yes, you are.
There we go. Good boy, Buster. Good boy. A couple quick x-rays and a little look down your mouth, eh?
At the emergency hospital, Gerardo is starting to suspect elderly Buster has a condition called laryngeal paralysis, which is severely affecting his breathing.
Let's see. This is the x-ray of his neck where that noise is coming from.
He's hoping an x-ray will provide more clues.
This is his larynx.
Oh, yeah. I can see what you're talking about just here.
Around there as well.
Yep.
I think it's probably, how old is he?
13 years old.
Okay, so he's an old boy.
Mm.
I think it's probably associated with his age, just calcification.
I think next step is have a look down.
Yeah, see how his larynx is moving.
Yeah, that's
good
right.
plan.
You're a lovely old boy, aren't you?
Well, he's a sweet soul.
All right, Buster, just a little sleep, okay? I'm just going to give you a little bit of twilight anaesthetic.
Okay, let's have a look. What we're going to do now with Buster, we're going to give him a drug which makes him breathe in deep, and we're going to have a look at his larynx. So what we should see is when he breathes in with a big deep breath, those doorways down there, those airways should open up. Wow, they're getting sucked closed.
Yeah, they're just not even hardly moving at all, are they?
Yeah. From what I can see down his airways, it confirms my suspicion that he has laryngeal paralysis.
Oh, good boy, Buster.
Good boy.
Yeah.
Okay, let's let him wake up with that.
He should be able to breathe a bit easier now.
There we go. The larynx is a set of doors which protect the airways. So when you breathe in, the doorways open and let air down into the windpipe. But when you swallow, what happens is those doorways close and then food goes over the top down the esophagus. If he gets too stressed out or even excited, he'll start to breathe faster and spiral down into respiratory distress. Okay, pull the tube out time now. Good boy, good boy. Okay, let's see how he breathes. Okay.
Unfortunately, with Buster's condition, there is only a limited number of ways that we can help him.
Good boy. We're going to give him some anti-inflammatories which will reduce the swelling at the back and start him on those medications which will keep him nice and calm at home. Home in the morning, your family will be happy to see you. Good boy, Buster.
Hello, you awake? Oh, you're looking very bright.
Next day on the Gold Coast, Alex has some early morning good news.
I hear you've eaten a whole bowl of food overnight.
When I see Ellie this morning, she looks great. She's had no more retching and I think she's ready to go home.
You do look a bit different. What's your mum going to say?
Despite x-rays, a thorough physical examination and shaving her for ticks, the reason for the 5-year-old's sudden dry retching is still a mystery.
Hop in, good girl. There you go. Okay, let's go and take you to your mum.
Although we don't know what caused Ellie's retching, I think Shirley is going to be very happy to see her. I know how much this cat means to her.
Now, do you recognise your Ellie in there?
Oh my goodness, darling, what have they done to you?
Yeah, even her collar looks a bit big now.
Is it doing?
It'll grow back. Pop in, good girl. She's still a bit of a mystery, but I think let's get her home.
Yes.
See how she goes, and hopefully, no more problems.
No.
You good boy, Shane? Good boy, Shane.
In Melbourne, Rosie is waiting for Dr. Danny to arrive to help sort out her big boy Shane.
Drop. Good boy. Shane is a gorgeous, loving, cuddly puppy dog. Good boy. Ready? Good boy.
But fun-loving 2-year-old Shane has an embarrassing problem.
Oh, you're a stinky boy. He's got a bit of a scent, plus this sort of oily, grimy skin. Let's hope Dr. Danny sorts you out.
Here we are.
What a beautiful boy. Other people are starting to notice, which is a bit embarrassing. I just feel bad for Shane because he's so loving. He wants to give them a cuddle and they don't want him anywhere near them. So we need to sort this problem out.
Hello, Rosie.
Hi, Danny. How are you going?
Hi, good. Hi, Shane. Hiya, Papa. Oh, my goodness. I walk in to meet Rosie and Shane today, and straight away it's a bit stinky.
We love Shane. He's a gorgeous, loving and very cuddly dog.
Oh, yes.
But he smells.
Oh, dear. Okay.
And I just can't take him anywhere.
And have you noticed anything else strange about his coat?
Look, if you touch it, it's quite oily.
The Bulldog Mastiff cross has another problem that doesn't help when you've got bad body odour.
He seems to have developed a little bit of a fear of the water.
Okay.
So it is quite a challenge to lure him in and then hoist him up and get him into that bathtub.
I bet.
He used to be good at having a bath when he was a puppy, but now he seems a bit scared. We try to bathe Shane as often as we can, but getting him into a bathtub is very, very challenging.
All right, Shane, let's have a little look at your skin, mate. Hey? Oh, yes, I can feel all that grease. Oh, dear. Oh, dear, Shane, you are a smelly boy. Hey? In the groin as well, and in the armpits. This is definitely abnormal. What I think is going on with Shane is that he has a condition called seborrhea. I can see the sebum actually on my hands, so we definitely have a problem there today. In Shane's case, he's not actually dirty. He's got an overproduction of sebum that's causing all of that oily skin and the smell. So we've just got to get that under control. The good news is I do have something here today that I think is going to help a lot.
Okay.
Now it does involve having a bath though. How do you feel about that?
I'm game with your game, Danny.
Let's give it a crack. Shane is a big boy and I hear he doesn't like baths, so this might be tricky getting him into one today. Oh, darling. Hey.
Have a look at this, hey?
At the emergency hospital.
Talk about metal. Look at that. How sharp that looks.
It's a bizarre case of deja vu for Alex and Gerardo.
I can't believe this. Is that the hole?
Yeah, that's the eye of the needle. It's actually a sewing needle.
This is the second pet which has come down for playing with a needle.
If he's swallowed that, that could even have moved out of the esophagus and be sitting in his muscle tissue.
That needle could puncture something vital or cause a lot of trauma to his airway. Anything that interferes with a dog's ability to breathe is life-threatening.
Here we go.
Here's
the boy. He's arrived. His name's Ralph.
Hey, Ralph.
He's a bit worried. Good boy. Good boy.
The anxious dog has been struggling to swallow and hasn't eaten anything in 3 days.
So it's up in his neck.
Yeah, it's just so hard to see exactly where it is, isn't it?
And they can be so hard to find.
All right, matey, let's get you through.
From my previous experience with these things, they can be super tricky. There's only two options. One, we're able to go in there and find the needle and remove it, which is ideal and what we hope for. Or two, we have to go and surgically explore, but we don't want to do that because there are so many vital structures there.
Hey mate, hello. It's okay.
That's it. Good boy. Off to sleep. And hopefully when you wake up...
You don't have to worry about that thing in your throat anymore.
Right, good boy.
With Ralph now sedated, Alex and Gerardo can take a close look down his throat.
9 tube. Yep.
Thank you. Yeah, maybe because I've just got to have a look. Yeah.
Oh, there's a string there. See that string?
Ralph has done us a huge favour. At least he's swallowed a needle with some thread attached, because we may be able to pull on that and get the needle out.
I think we should make sure we get hold of the string so we don't lose it.
Okay.
Before we start.
That's good thinking. Oxygen on?
Yep. Oh, now. That tube's not going to make anything easy. Oh, let me hold the tongue.
Looks like it's coming out of went through the top of the roof of his mouth.
Oof, don't lose that string.
We're all holding our breath now. The thread is soft and very delicate, and we're hoping that it doesn't break.
Okay, just be so careful.
You got it?
Yeah, great. Thank you.
Ooh, it's coming.
Yep. Keep pulling, just gently. Just don't want to snap that piece of thread.
Whoa.
Ooh, you just don't want him swallowing.
Okay, Shane, you coming? Come on, are you going to be good for Danny? Come on, Shane.
In Melbourne, 2-year-old Shane badly needs a bath to treat a skin disorder that makes him unbearably smelly.
Shane, it's bath time.
But Danny and Shane's owner Rosie have a big problem.
He just doesn't like getting in the bath. He's 55 kilos at 2 years old. He's quite difficult to wrangle into a bathtub, so I don't think Danny knows what she's in for.
So I'm going to suggest that we use this little trick, and it's smearing this delicious peanut butter.
Shane looks excited.
To lure you in. Good old smear. Let's see if this works. Come on, Jane, in you come. In you come. It's working. The peanut butter worked. I'm thrilled. He actually just walked himself into the bath today. It's fantastic. Now, we're halfway there, mate. You're doing so well. Let's see if we can just assist you in the back. Good boy. Yummy. Look, there's some yummy peanut butter. Oh, yeah, good boy. All right, let's get into it.
Oh, I can't believe it. When Shane first goes into the bath, he goes in easily. Danny proved me wrong. A little bit of peanut butter, apparently that's all he needs.
All right, mate. Just gonna let you down. That's a boy. Good job.
He's being so good.
We don't need a bath, Shane, but thank you.
Danny can now begin treating Shane for his unpleasant odour.
So I recommend we use the medicated shampoo, and it's going to help resolve all of that seborrhea, as well as sort out any surface infection that's going on, so bacteria, yeast, that sort of thing. So we need to lather this up in all the problem areas.
I think he's liking his massage.
I think so. Does that feel nice?
It's a bit of a workout, giving
I know. It is. So you want to do this shampooing twice a week for 3 weeks, and then continue to use it weekly ongoing to keep that seborrhea and surface infection under control.
I think Shane is loving his bath. Who wouldn't want a full body massage on a beautiful summer's day?
Bath time fun, hey?
The 5-minute lather is up.
So lovely and fresh, hey?
Time for a quick rinse.
Oh, no, not yet. No! Hang on. Get under your neck. Such a pamper session for you, hey? Stage 1 has been successful. Now for stage 2.
And finally, some conditioner.
Just dab it everywhere and lather it in like it's a moisturiser. And then that's just left in to dry. And that'll keep all the moisture in the skin and be a bit of an extra barrier to allergens and things like that as well. After just that one bath today, Shane is smelling beautiful and his skin feels fantastic. I'm sure he is feeling a lot better too. Oh, I think you're going to be a bit of a hit with the ladies at the park now, mate, hey?
Oh no, he's getting dirty
Oh,
again.
mate, out of the garden.
Looks like it's coming out of the top of the roof of his mouth.
Oof,
Yeah.
don't lose that string.
Whoa.
At the emergency hospital, Alex and Gerardo are trying to carefully remove a needle and thread that's lodged deep in Ralph's throat.
Oh, it's coming. There's a heap of tension on it now. It's slowly coming.
Just pull gently. Oh, yep, I can see it coming through there.
Oh.
Oh my God.
Suddenly, the string comes away and there's no needle. We've lost this.
Sit down the back of the throat.
Oh my gosh, this is so lucky. Then I see by some miracle, the needle is in the back of Ralph's mouth.
Oh, how lucky is that?
The thread undid as we were pulling it through.
But it brought it right to
But
the
it brought
edge.
it right to the edge. Ralphie, you're such a lucky dog. This means there's no surgery for you.
And that's been there for 3 days.
Imagine it slowly digging its way the back of the throat.
Yeah, it's a bit traumatised. And I think he's probably going to need some antibiotics and some more pain relief for the next few days, but that is amazing. You may as well have a pedicure while you're at it, Ralph.
I haven't trimmed nails in ages. Things could not have gone any better.
But now Alex and Gerardo want to do an X-ray to make absolutely sure Ralph hasn't swallowed anything else he shouldn't have.
X-ray. How'd we go?
Really good. It's gone. There's nothing there now, so we got it.
Good job. You were so lucky that string was there.
I know. I just think he's unlucky, but he's lucky at the same time. So, but I just don't know what made him swallow a needle and thread.
2 hours later...
Hey, little Ralphie. You look all bright and happy. Now's the time for the final test. See if you're eating okay. Can you eat the chicken? Will you like the chicken? You want the chicken? Or you eat the chickens? It's your first meal for a couple of days, hey? Is that good? Is that good? Is that good? Hey? Now let's get you home, hey? Pets and needles and 2 on the same day. This would have to be some kind of record. This way.
How's our mini girl going?
She's doing really well.
Yeah, she's been good with healing, leaving those stitches alone for us.
She has, yeah.
In Sydney, Audrey has come to check on Minnie the cat a fortnight after removing a cancerous lump from her face.
All right, let's have a look at how it's healing.
It's looking pretty good. Good girl, Minnie.
Oh, I like how that's healing. That hair's growing back already as well. I'm pretty happy with the work we've done. I'm just glad we got everything together and the eye looks pretty good.
I was worried about her eye opening and closing, but she seems to manage.
Yeah.
It opens and closes well. And
Yeah, and certainly, you know, that might relax a little bit once we take the stitches out as well. But I'm quite happy with how it's healed.
It's perfectly healing. It looks really good.
I know Minnie's so important to Andrew. Has he been missing her a lot?
He has.
Yeah.
He has.
Now, those results from the histopathology lab have come back. It has come back as a nasty one, so what we call a squamous cell carcinoma.
The biopsy results confirm Minnie's ugly lump was indeed cancer.
The good news is, even though we didn't have that much skin to play with and it was really close to the eyelid margin, we actually got it all. Generally, if we get it all and her lymph nodes are okay and the rest of her bloods are okay, there's probably no spread, so we got it just in time.
You hear that, Minnie?
Yeah, very lucky girl.
Yes.
So when you look at Minnie, I think everybody's pretty happy with how she looks now. That nasty lump has gone from her head, and it's actually healed very well. There's always a chance that a nasty tumour can regrow, so fingers crossed it never comes back again. All right, let's take those stitches out.
Good girl, Minnie.
All right, baby girl.
Once the stitches are out, Minnie can return to owner Andrew's bedside.
Nearly finished, Minnie. Really done. That is so good.
Ta-da!
Oh, brilliant. Look at that. Andrew will be happy to see her. He's missed her. Now they can get back to their normal life. Really appreciate it.
Of course, anytime.
And Andrew will be very happy to have Minnie back.
Bye, Minnie. Bye, Charlize.
Thank you, Audrey. Thank you so much. Bye.
Come down. Look what I've got for you. Isn't that fun?
Several weeks after Kate's visit, Axel's constant barking has almost stopped.
Yum.
Food puzzles are helping to relieve Axel's boredom, and owner Jess couldn't be happier.
We are challenging him every day, and we are watching TV in peace and quiet every night. So Dr. Kate knows her stuff.
And it's good news for big, lovable Shane. Owner Rosie has been managing to keep up his regular medicated baths, and his smelly skin condition has cleared up.
We can take him to the park. Everybody loves a cuddle with him. It's been amazing, the change.
He's 7 months old.
Hello.
On the Gold Coast, young Border Collie Apollo has been rushed into Gerardo.
Oh, good boy.
Apollo's been brought down to us today because his owners found metal stuck around his back tooth.
He was outside in the garden today. We have no idea what it could even be or it's from.
Owner Lani acted quickly when she saw Apollo in trouble.
It's quite concerning, so I definitely had to rush in today. Hopefully he'll be okay.
Okay. One little quick peek if we can.
You can see it's stuck in the side there. It's gone right into his gum.
Oh, wow. Yeah, definitely something there. That is not going to be easy to remove. If you're going to get that out, there's a possibility it could stay there and actually burrow down into the bone, or if he actually swallows it, that could actually perforate his stomach. Okay. Small little needle. Small little needle. Good boy. Good boy. Oh, you're a brave man. Okay. I've given Apollo some pain relief and he'll soon feel a lot better, but there's no way that he will allow us to remove that without an anaesthetic. Okay, Apollo, it's all right. And give some time for that pain relief to kick in. There we go. There you go. Stay there.
He's naughty.
He's so cheeky.
Because he's cute, he thinks he can get away with like a lot of things. But
Yeah.
it works. But you fell in love with him like straight away, so you start to be like, I love him so much.
Cute.
Yeah.
Now that Apollo's had his pain relief, we can give some time for that to kick in and develop a plan.
Well, she's a big snake. It'll be fine. Okay, cheers.
At the Australian Reptile Park, Tim's trying to catch up on some paperwork.
Timmy,
Hey.
do you have a sec?
Yeah, I do. Come on in,
Thanks,
mate.
It's just got Holly here, mate. She's got a bit of bloat. She's not taking her milk.
Yeah,
She's
sit down.
really lethargic.
Keeper Hewan has been hand-raising a young wombat that's suddenly become unwell.
You're concerned that she's going downhill?
Yeah, definitely. We haven't been putting on weight. We're not drinking the amount of milk that we're supposed to be.
We have an orphan wombat, Holly. Her mum was hit by a car. A wonderful family stopped. They checked the pouch. There's Holly. They saved her life. And now we have to do that again and Henry her.
She's very bloated. She's got lots of runny feces and just her general behaviour. Look, you can see she's really lethargic right now.
And all of that has changed?
Yeah, last couple of days. Holly's not well at all, which is really sad. What's wrong, honey? Bit restless, are you?
Hewan has been caring for Holly around the clock since the one-year-old arrived at the park 6 weeks ago.
She's very sweet, very playful. We formed a very strong bond, taking her home, spending that much time with her, playing with her, feeding her. She definitely has touched my heart.
Let's just have a look at her for a minute. Come here, Hol. Movement seems fine.
Yeah, she slowed down a little bit, but I think that's obviously because she's bloated.
And that bloat in itself is going to give her big problems. What about her breathing?
It's been a bit fast.
Holly, I actually need that. Hey. Come here. Well, you still got a bit of spirit.
Holly's just acting up at the minute. She's in a very awkward stage now where she knows that I'm not mum and she knows that what I'm offering her isn't what she's used to. So she's not being herself at all.
But we can see she's bloated. But just listen with a little flick.
Yeah.
Rock hard.
Yeah.
You know, that's pushing all of her organs up. It's hurting her. And considering that she hasn't been eating, she's going to have something going on in her guts. Holly came to us at a really vulnerable age. It's a transition between still being dependent on milk and not being able to survive on solids. Well, mate, I'm going to take her for a run up the vet.
Yeah.
I think that's best. You get on with what you're doing and I'll give you a yell when I'm back.
Yeah, thanks, mate.
You want to come for a ride at the vet? You give me kisses. The thing with wildlife is they will break your heart. They can be fine 1 second and gone the next. I'll give you a yell when I get back, all right?
Lovely.
It's all right.
At the Bondi Veterinary Hospital, anxious owner Erin is waiting to see Kate after her 4-year-old cavoodle Louis suddenly started crying out in pain.
Good boy. Erin's really worried about Louis. Louis come in today, every time he jumps up, he screams. And not just a little scream, I mean he screams.
Hey Erin, hi. How are you? Good, how are you? Hey Louis, how are you mate? Hey?
I feel like Louis is like a big part of my life. I take him to work 3 times a week with me, and then when we're working at home, he's always by my side. This is kind of scary for me. It's the first time something quite serious has happened and he's been in a bit of pain.
When I pick him up, he'll like scream in pain.
Okay.
It's also like if
When you pick him up or when he jumps up, or he won't even
He
try?
won't even try.
Okay,
now.
yeah. The way that Erin is describing this sounds to me like there's some kind of orthopedic pain. So that means there's possibly some kind of pain in the neck or some kind of pain in Louis' back.
I know, sweetheart. Be very careful.
Very careful. How long do you reckon it's been going on for?
Like Friday midday I noticed it, and
Yeah.
then it got progressively worse Saturday day when we were home with him.
Does sound like it's possibly a neck or a back, but I just want to make sure it's not anything else.
Okay, sure.
You know, being a vet is like being a detective. You've got to try and figure out as many pieces of the puzzle that you can possibly find, because if you miss a piece, it could be a really vital clue as to what's going on. Good boy.
Oh, wow. Yeah, definitely something there.
At the emergency hospital, Gerardo urgently needs to try to remove a piece of metal stuck in Apollo's gum.
Hey, matey. Oh, good boy. Time to try to get that thing out of your mouth, yeah?
Gerardo's worried that if he doesn't remove the metal quickly, Apollo could swallow it and perforate his intestine.
Good boy. Let's replace an IV catheter. This will enable us to give him anaesthetic so that we can have a look in his mouth and hopefully remove that metal object.
Very brave.
Almost there. Oxygen's on. Anaesthetic is on. My concerns are that this piece of metal is wrapped really tight around his back tooth and it could be pretty difficult to remove. Oh, look at that. Ow. That is one side of a U-shaped clip. That has pushed through his gum. Must be painful. I think I'm gonna have to cut it off. So what we'll do is we'll flip it up this way and I'll get the bolt cutters and then we'll try to get that off. Got the cutters.
Could you get any smaller ones?
Yeah, I could. But these ones, I like these ones because nice and precisely cut something without having to use your wrists. That's good.
On the New South Wales Central Coast, Tim has arrived at the local vet with sick wombat Holly.
Come on, Holly. Hello.
Hey, Tim, how are you?
Good.
What do we have here?
This is Holly.
Hello, Holly.
I don't think you've seen her before, but she came in about a month ago.
Yeah, you don't look very happy. Come on in, let's have a look.
Thank you.
Tim's colleague Ewan is hand-rearing Holly and raised the alarm when she refused to eat.
There's an extra towel for her because she has been popping off and going to the toilet more than usual.
Okay, no worries. You are very happy. Look at your little eyes.
Vet Robin is an expert at treating native wildlife.
There we go. Oh, you're definitely a little bloated, aren't you? When wombats get bloated, it's such a large part of their digestive system that's not working properly that it's very difficult to get the system working again. You can definitely see this big belly. It's so tight, too. Grinding her teeth?
Yeah. Ewan's very emotionally attached to her.
I would imagine.
He's had her about a month.
Okay.
It's a terrible age.
Yes.
Because she still needs the bottle, but she won't take it.
Yes.
So he's been trying a range of grasses. I'm not exactly sure what types, but she's got the runs. She's had a temperature. She's gasping.
Mm-hmm. So we'll take a quick x-ray and then we'll formulate a plan.
Yeah.
Good girl. Okay.
I don't like coming to vets. They make me nervous at the best of times, but it's an essential. And for Ewan, I think it's best I've come because it just removes the emotion a little. Have a robust chat with Robin and really find out what's going on.
Come on in, Tim, and have a look. So that's all very unhappy intestine. She's got really bad gas, and so this is her diaphragm.
Yeah.
This separating the abdomen from the chest, and that's why she's having so much trouble breathing. She does have a little bit of pneumonia as well. And that's this patchy pattern here.
This is
clear. That's the
the
chest.
cloudy part, or that should be clear?
That should be clear.
Oh, poor little bub. She's in strife.
She's quite ill, unfortunately. It's vital for her ability to live, and she must have a functional digestive part of her gut. She also has aspiration pneumonia, which makes it doubly difficult to treat her.
Oh, you poor thing. You right, Hole?
Tim fears Holly might not survive.
It's a real worry because, as you know, I've seen a lot of wombats go downhill very quickly at this age.
Yes. It's a very tough age.
Does sound like it's possibly a neck or a back, but I just want to make sure it's not anything else.
Okay, sure.
At the Bondi Veterinary Hospital, Kate's trying to find out why little cavoodle Louie has suddenly started crying out in pain.
Its heart rate's normal. It's got a good little heart. It's not dehydrated, which is good. And round this way, Louis. Good boy. You can see he's a little bit stiff to the left there, but he's actually pretty good. Like he can get all the way around. We're going to go up the spine. So we're going to start at the bottom here. Every little vertebra, have a little feel that was uncomfortable. You tell us where it hurts, mate. Does it hurt in here? Louis like, I'm not going to say a word, dog. Okay? Not a word.
Of course.
Dogs, especially at the vet clinic, don't love to show that they're in pain. They quite often mask their pain when they're stressed. Louis is no different. He's here saying to me, I'm fine, Mum, we're fine, let's just go home. Let's go like yoga dog, yoga dog. And knee this one. Can we go yoga dog? Out we go. His hips are amazing. He has got seriously good hips. His knees feel good. Everything else is going pretty well. I can't find any real sources of pain in Louis. He's 39.5. It's borderline, it's pretty hot. What I can find is that Louis has a temperature of 39.5. Is he just hot because it is absolutely boiling outside? Or is he actually hot because he's actually carrying a temperature? And I just want to see that he's actually not sore anywhere else. So as you know, like for example, things that can mimic things like back pain. So abdominal pain, sometimes you can actually have referred pain from the back. And then the other thing is obviously things like kidney pain. So that's just precautionary. Take some blood off him. Check his bloods. That's it, Chook, you were very brave. Would you like a little chicken snack?
Louis is feeling miserable, but Kate is hoping she can tempt him with a treat.
No, I don't want it, Dr. Kate. Are you sure, Louis?
Got the cutters.
Could you get any smaller ones?
At the emergency hospital, Gerardo is going to try to use bolt cutters to start removing a metal clip embedded in Apollo's gum.
Okay, you ready? Hold him still. Hold him still. 1, 2, 3.
Wow.
See? Nice and easy. There we go. It was like this. Somehow he swallowed that and went over his tooth, and these edges here, these little indents here, went on either side of his molar and burred away at the gum and also at the bone there. Now that the clip has been removed, I can see that the bone has been burred away and the root of his tooth is exposed. I'm hoping that the gum will heal back over, otherwise Apollo may need to have that tooth removed. The only thing we can do now is give it time and see if that heals. So let's wake Apollo up, but I'm fairly certain you'd be happy that that's off his tooth now.
Definitely.
Here we go. Good boy, good boy. Good boy, Apollo. There we go. Good boy. Once Apollo's up and walking around, we're gonna offer him some food and make sure that he's able to eat on that side. And if he's okay with that, he should be fine to go home. Oh, Apollo.
3 hours later, Apollo has woken up from his anaesthetic.
We got some chicken. I just offered Apollo some chicken and he hoovered it down. And he didn't have any signs of pain, and I checked his gum and there doesn't seem to be bits of chicken stuck in it, so he should be fine to go home now. Good boy.
Now that it's over and done with, I feel relieved. Definitely excited to have Apollo back. We've been waiting by the phone, seeing when we can come get him, so we're excited to see him.
Apollo's relieved owners, Lani and Dakota, are keen to take their cheeky boy home.
Mummy and Daddy are in here. Apollo, get this way.
You're so silly.
So, it was...
Oh my goodness.
Like that. That must have been there for like at least a couple of weeks, I think.
Oh my goodness.
For it to go to that degree.
Thank you so much. Oh.
Thank you so much.
No problem at all, guys.
You tell us where it hurts, mate.
At Bondi, the cause of Louis' severe pain is still a mystery.
That's just precautionary, take some blood off him. Sure.
And owner Erin is becoming increasingly worried.
Initially I was worried about Louis, that it would be like a broken bone or something and he would have to go get x-rayed, but now I'm kind of worried that it's something more serious, something to do with his liver or something really internal. So yeah, I'm kind of worried that it's something bigger than I initially thought it would be now.
What have you got for me?
Kate's hoping blood tests will provide more clues.
So we've got a slightly high elevated liver enzyme and we've also got an abnormal pancreas. So there is something going on in his tummy, not his back. Guess what, Lou? You've got pancreatitis.
Oh my gosh, really?
You don't have anything wrong with your back. You have something wrong with your pancreas. You got the pancreatitis. Pancreatitis is very serious in dogs. Dogs often end up in hospital, they end up on IV fluids, they end up very, very sick. Sometimes they can even end up dead. We know that there's some kind of genetic component, right? So it doesn't happen in every dog.
Oh, okay.
And we know that there's usually some kind of trigger on top of that, right? So that trigger can be something like a high-fat meal, for example. So it could be something like a red meat, like a lamb or a beef. I think we've caught him pretty early.
Okay, that's good.
He's eating at the moment, right?
Yes.
Erin's done a really good job bringing him down today. If we hadn't have caught this could have gotten really serious. What we need to do today is I'm going to give him some antiemetics, so something to make him feel better.
Sure.
A pain relief. And some antibiotics.
Okay.
Good boy.
How'd you get something wrong with your pancreas? I don't know.
Oh, good boy.
He's a good boy.
All right.
You're going to feel better in no
yeah,
time, mate.
I think that's great.
Okay, so you know what to do?
Yes.
Okay, you've got all your instructions.
Yep, I do.
Lou, be a good boy and take your tablets. Even if Louis wasn't squealing, I bet she still would have brought him in because I know Erin and I know that she would feel like there's just something wrong with him. And those are the signs that I want owners to look out for. And when you're in tune with them, you know there's something wrong with your dog. Good boy.
"300 kilometres south of Sydney, Mobile Vet Allison is on her way to an extra special reunion at the Possumwood Wildlife Sanctuary.
So I'm so excited today. It's a huge day. We're going to Possumwood and Bungadore. We're going to surprise Audrey, my twin, who I haven't seen for 5 months. So it's been a really, really tough 5 months.
COVID state border closures have kept Allison and her twin sister Audrey apart. But with restrictions now eased, Allison's planning a surprise visit, just in time for the opening of the sanctuary's new animal hospital.
I can hardly contain my excitement. I haven't seen her. Just want to give her a big hug. And then doing the stuff that we love at Possumwood. So excited to see everyone.
Audrey is already at Possumwood and is checking out the new facilities she's helped to build with owners Rosemary and Steve.
This is the waiting room.
This is the waiting room. Air conditioning in all the rooms.
Wow.
What I love about Audrey is that she's really driven. It was back in the bushfires that we discovered Possumwood and started helping out the roos in the area, and since then she hasn't stopped. She's continued her passion. You know, she's now helping Steve and Rosemary set up this wildlife hospital in the sanctuary to prepare for the next bushfires.
Got my coffee, water for the day, and some presents for lovely Rosemary and Steve.
The precious moment has finally arrived.
I haven't unpacked all of that stuff yet.
Wonderful. And then this is the surgery.
Yeah, so you can get 3 levels of light.
What are you doing here? Oh my God!
When she came around that corner, just fell to the floor and it was just the biggest shock of my life. I was so happy. It was so emotional.
What is going on? Really? I thought you weren't coming.
You know, it's just been really tough, just personally, professionally, just not having her by my side. So her coming down, it meant the world.
Oh, you weren't coming. That's so sad. Oh my God, don't tell me you cry. That's so embarrassing. I never cry. But it's also really weird because I feel like we haven't ever left each other. It's like things are just back to normal.
It's like when I see you, everything goes back to as if nothing happened.
Nothing happened. Back to business.
With so many sick and injured kangaroos to treat, the hugs can't last forever.
I'd really like to do the x-rays from the ones we've been holding off on.
You right?
On the New South Wales Central Coast, Tim has received devastating news that orphan wombat Holly has pneumonia and a life-threatening intestinal condition.
You right, Holly? She's a sick little wombat. And before you come to the vets, for me anyway, my fingers are always crossed, you know, they're optimistic. It'll be fine. But she's got big problems.
Critical care, we need some fibre.
Vet Robin is putting together a course of treatment she hopes will save Holly's life.
Motility modifier, so this will help move the gas on through. Wombats are fairly hardy marsupial, but when they start to get ill, they go downhill very, very quickly. All right, Tim, we have a plethora of medications for you. This shot is a drug that moves the gas on through, so it increases the ability of the gut to move. So we'll give her this. She's not going to like it. Good girl. There we go. Good girl. Oh, you were
Well
such
done.
a brave little girl. Look
Well
at you
done,
go. So this is a good gut antibiotic. It's also good for her lungs.
Holly will need a range of medications to fight pneumonia and cleanse her seriously compromised digestive system.
And what do you think at the moment? Just maybe a couple of rehydration feeds?
Yes.
Introduce a little milk after that? Half feeds?
I would do half feeds, but definitely I think it's good to get her gut at rest.
Just flush her out a little
Flush
bit.
her
So
out a
keep the
little
fluids up?
Yep.
Okay, no grass?
No grass at this point. 'Cause
No
we're
solids? No need for...
Yeah, not yet. Bloat in wombats is very difficult to treat. Aspiration pneumonia is actually easier to treat than bloat. And it's because the organ is so large and it's such a complicated digestive system.
Well, it was nice to see you, and I hope I
Good to
don't
see
see
you
you
too,
again
Tim.
too
All right.
soon.
Yeah, definitely.
All right.
Keep
Bye
me
for now.
updated.
Yeah, thank you.
You're welcome.
I'm shocked, I'm saddened, but she is in a very precarious situation. And now, I think there's a bit of luck involved, and I don't like luck.
Jimmy, we need to have a little bit of a talk about your scratching situation.
In Bondi,
Hey, don't eat the rug.
Kate's new housemate is causing havoc.
Ow. Oh my goodness.
3 weeks ago, Kate discovered Jimmy living in a cattery in her hometown of Canberra.
It was like love at first sight. I knew what kind of cat he was when I got him. I felt like as though the moment I patted him, I thought, this cat's mine. Jimbo, that's what we'll call him. Let's go. We're going back to Sydney.
Back in Bondi, it wasn't long before Jimmy began to show his true colours.
Oh. Don't. He just went at my face and split my lip open. And that was the first, I guess, hurdle in our relationship. Now, Jimmy, be nice to Benny.
Kate's 14-year-old golden retriever Benny is also under siege.
You don't own this couch. Benny you need to share. You two, sharing.
Jimmy's also wrecking Kate's furniture.
Hey, don't eat the rug. Hey, don't eat the rug. Jimmy is a total destroyer. So I went out and I literally bought him like 4 scratching posts. He's got them everywhere. I tried to encourage him to use these scratching posts and he never uses them, ever. We just can't live like this with you destroying everything in sight. And people, no. Dogs, couch. This is just not gonna work. Like, I don't know actually how to stop this.
At the Possumwood Wildlife Sanctuary,
Oh, I thought you weren't coming.
it's been an emotional reunion for twins Alison and Audrey.
Being an identical twin, you are the other half of each other, and it's been really hard being separated because it feels like I've lost one half of me. Oh my God! Okay, go on explaining the hospital. It's like so familiar but almost not real because I haven't actually been able to touch or feel her for the last 5 months.
But now it's time to get to work.
And then there's another wall that comes from here to there.
The twins' first task is to set up the hospital's brand new operating theatre.
A goes into B.
This new facility is almost like the finishing touch of my work. It also means that, I can provide a service that's much better than what I've been doing. It's been a lot of planning. To see it finally finished today and all that equipment in there means the absolute world to me. And also to do it with Alison.
So we've almost got the surgery room all set up. We've got the anaesthetic and the IV fluids. We opened our brand new light, which is great. Got our ET tubes. So we're almost ready to go to treat our first surgical patient.
Longtime Possumwood resident Laurie has recently developed a worrying eye infection and needs urgent treatment.
Laurie's one of my favourite boys at the sanctuary, but we're really worried about his eye. Oh, that looks nasty. Oh, wow. He's got a big swelling down there and his eye's weeping some pus, so I'm interested to go in, have a look and find out what's happening. You can see all the conjunctiva, so that pink membrane is swollen and that third eyelid's actually coming across the eye. And there's just all this pus everywhere, so I'm just trying to figure out where the pus is coming from. That infection is just collecting under the eye and potentially could spread into the bloodstream, which is dangerous. There's pus. There's pus actually dripping up behind the tooth here, right under where that eye swelling is. The original plan was to have a look at the eye, find out where that swelling is coming from, and perhaps make an incision just under the eye to remove the abscess.
So it could be a tooth root abscess.
Oh, yes. Later on, what we found, looking in the mouth, is that actually one of his teeth is wobbly.
Is there grass stuck in there too?
Yeah, there is grass. Yeah. So when I'm fiddling around that cavity above the tooth, I actually find a big blade of grass.
Oh, wow.
So I pull that out and flush through. Could be the grass that's causing the infection as well.
Yeah, it's grass. Massive grass.
That's terrible.
The next step is to remove the tooth. Because it's wobbly and it's not healthy, we've got to get it out.
So that's when we do what I said.
Some of the tooth. Okay, that's the other root. And once we get it out, we've got this nice big open cavity that we can flush all that pus through. Looking at the tooth root area where I extracted the tooth, and all this pus is just coming out from that hole. So that kind of confirms that the infection's coming from that area.
So that tooth came out really, really easily. Definitely that rotten tooth being out of the mouth is going to clear up that infection straight away. So good result. And that would have been very, very painful. Poor Laurie.
How's your eye feeling? I'm really happy with his progress. We'll come check on him.
With Laurie now recovering, the two sisters can finally have a moment to catch up.
I timed it perfectly.
And I was very, very surprised.
It just feels like normal to be back together. It feels like we haven't even missed 1 minute of 1 second of 1 day apart.
It is. It's really, like that first 5 minutes, it was kind of surreal, and then I was like, is this happening? And then straight after that, we went into work and it was like, oh, she's been here the whole time. It's like you haven't even been away.
Just like back to doing surgery together, back to treating our wounds together.
so weird.
Like we never left. This was a dream.
At the Australian Reptile Park, Tim's returned from the vet with gravely ill wombat Holly.
I'm back, mate. Oh, thank God.
Anxiously waiting for news is Hewan, who's been hand-rearing the young orphan.
I don't bring good news.
What's wrong with her?
Well, a few things. Right. On the X-ray, you can see her digestive system is so bloated from down here right up to her lungs. And wait for it.
Yeah.
She's got pneumonia.
Really?
Yep.
It's hard not to feel responsible being the keeper that's hand-raising her. You think you might not be doing something right. It does hit your confidence a little bit.
And look, I just want to reassure you, mate, that it's not your fault.
Okay.
The reality is that he could have been with her when she came. And the challenge of having a wombat that doesn't want to take milk because she misses her mum and can't eat solids, this could have been happening for a month, mate, and
So
it's just blown up.
Not necessarily something that I've done.
Well, are you planning on having kids?
Not really, no, not now.
I'm joking, mate, I'm joking. Telling Ewan, I felt like I was giving bad news to one of my kids that Santa wasn't coming or something like this. He's put his life into that wombat. He has spent every minute round the clock, and so to him, it feels like what it would to me if I had a sick child.
So any medication or anything?
Yep, no milk.
Okay.
For at least a few days.
Right.
No solids, okay? So
Yep.
she needs to be on a rehydration, lactate, electrolytes.
Yep.
You've actually got to get her gut working again.
Yeah.
So patience, mate. I know how much you've put into her.
Yep.
And you've got to do that again, and it's not going to fix itself tomorrow.
Yep.
You're going to have to battle through it. It could be 3 or 4 weeks.
It's going to be a long, tough road. Lots of medicating, lots of feeds of lactate and things like that. But I love her so much, I'd do anything for Holly. And if that means getting up 6, 7 times at night, I'm happy to do it.
Hello, you. Give her a go on that.
Give her a go now.
Ewan's first challenge on Holly's long road to recovery is to get the frail little girl to take a solution to help with dehydration.
She drinking?
Yeah, she's suckling pretty good.
Well, the lactate's quite sweet, so they don't normally reject it. And this is just going to give her fluids and clean whatever's in her gut out. With native orphans, you can't push it. You have to be patient. Holly's guzzling the electrolytes. That's a really good first result.
How good's this right now? The best sound I've ever heard, that sound of her suckling.
Keep going, Hol. Keep going. Holly needs Ewan right now. Ewan is her life support system. Here's your meds, mate.
Thank you.
Hey, Hol. Good luck, little one. You got a good dad. Give him a break. Get well. You right?
Yeah, mate, all
Okay.
good, thank
See
you.
you later.
I might spend a bit of time with her.
Yeah, good on you, mate.
No worries. It's hard not to form such a bond to the animal. Hopefully these medications work and we can get Holly better. You right, darling? Yeah, we'll get you feeling better. Hey? Yeah.
Come on, mate, this way.
In Bondi, Kate's come up with a plan to end her new cat Jimmy's reign of terror, and it involves a visit to the vet hospital.
Hi, I've got everybody.
Hi, everybody.
Jimmy and Benny.
Oh, Jimmy, what are you doing here?
So I've got this problem with his scratching, but I do have a solution. I don't know how this is going to go. You know that he gets really stressed. Oh, hey, buddy. Oh, Jimmy. Jimmy little. What I'm actually going to do is put some nail clips on him. It's a bit like having your nails done. He's going to hate it, but it is going to be amazing. It doesn't hurt him. It doesn't affect him. It's going to mean that Jimmy can't destroy my furniture, or me, or anybody else for that matter. We're just going to give Jimmy an anti-anxiety. It's not a sedative, it is just an anti-anxiety. I know Jimmy, he gets really stressed, and I don't want to put him through that.
There you go.
There you go. Okay, see ya. Back in your bag. See you later, kid. But what I've learned about Jimmy is that his anger comes from a place of stress. So when I know that, I feel for him. All he wants is for someone to love him and love him unconditionally, and that's me.
An hour later, it's time for Jimmy's makeover.
Whoa. He's
Do you
a
feel
bit
better?
wobbly.
The first step is to trim Jimmy's razor-sharp claws.
He's really relaxed, he's calm, he's definitely not carrying on like a pork chop. Go like this, get his claws clipped. I have wanted to do these nail clips for ages. I've seen them on the internet before and I've never had a chance to actually use them before. Jimmy was the perfect candidate. I feel like this black colour is great for him.
Yeah.
So this is a first for all of us. So look at them, they're nice and soft. And there is going to be no furniture scratching.
Oh, look how cute.
Despite the anti-anxiety medication, Jimmy's patience with his pedicure is running thin.
It's okay. He doesn't like me playing with his paws. He's giving me some warning signs saying, you continue and you will get nailed. Don't bite.
Jimmy.
On borrowed time.
It's okay.
We need to be quite quick at getting this last one on because Jimmy is having enough. Jimmy is getting way sick of being here. He's like, I've had enough of this. He was pretty tolerant at the beginning, but towards the end he is starting to lash out and I can start to see his anxiety come through.
Good boy. Good boy. It's okay.
And on. Look at you with your little black nails. Look at these little,
wow.
oh, look at these.
So handsome.
Don't like it, do you? Are you okay there? Are you okay?
So I'm heading out of Melbourne today to the country and I'm going to meet a real-life movie star.
Today, Danny's swapping the vet practice for a farm, where her friend Lauren trains animals to perform for TV and movies.
Oh my goodness, is that Montana?
Yes.
Hello. Gosh, she must be due any second now.
Oh, she's about 5 weeks to go.
Wow. Oh, yum, yum. What a treat. Hey? Oh, look at this.
You want to do a spin, Abby? Good boy. Up, 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 up. Abby, dancing.
Awesome.
Yes, good boy.
I'm having such a wonderful time with all these animals, but I have to remember I am here to work.
Good boy.
Back to business. I've got to go see Mac. Mac, have you been waiting here this whole time? Oh, I'm so sorry. Will you ever forgive me, mate? All right, Mac, let's get a wriggle on, hey? Let's check you out. Let's have a little look in your mouth. Is that okay?
A 3-year-old Border Collie Mac is about to star in a Hollywood movie. But before he can go on set, he needs to get a clean bill of health.
Okay, so we have got a little bit of tartar building up on those teeth, but nothing too severe at all.
Okay.
Let's have a look in your eyes. There's no inflammation. I'm gonna have a little listen, okay? Sounds beautiful. No murmurs, arrhythmias, nothing concerning at all.
Fantastic.
Well, I give you the all clear, mate. It's lights, camera, action for you.
What a relief.
So I've just done Mac's health check. He's got a full bill of health, a beautiful, fit and healthy Border Collie, and he is all set to get on set. Have you got any other dogs coming up into films?
Yeah, we do. We have about 14 in training at the moment.
14 dogs, my goodness, that would be a lot of work.
It sure is, and feeding time particularly can be really challenging because they're all got different portions, they're different sizes.
I have got something here that might be handy for you.
Okay.
It's really good at making life a lot easier and quicker when it comes to feeding time. It's great for portion control as well, if you want to have a look.
Yeah, fantastic.
Yeah? Okay, I'll go grab it.
Sounds great. It is fantastic to have Danny here today. She's just so good with the animals, so it's great to see her again.
So it's got measurements down the side, which makes portion control nice and easy, and then you just have to chop off the end and you get the perfect serving.
Okay, great.
Voila, dinner is served.
Great.
Come on, Mac, come get your dinner, mate. Oh, yum.
Good boy.
Oh. Now that Mac's got a full tummy, is there any chance you'll be able to show me some of those tricks he does in his films?
Oh, let's give it a go.
Okay.
Just spin. Good boy.
Oh, good boy, Mac.
Oh, good boy. Good boy.
Oh, good boy, Mac. Oh, darling.
Come on. Hold it. Good
Oh,
boy.
Mac, you're a superstar.
You're a good boy.
I've had the most wonderful day, Lauren. Thank you so much for having me.
No worries anytime, Danny.
Oh, Mac, you're such a good boy.
Say goodbye to Danny.
3 weeks later, it's good news from the reptile park. Little Wombat Holly has fully recovered from her life-threatening pneumonia and is continuing to thrive with round-the-clock care from Keeper Hewan.
Good boy.
And little cavoodle Louie's pancreatitis is now under control. He's pain-free.
Are you good? Are you good?
As for Kate's mischievous cat Jimmy, the new nail clips are working wonders.
The first thing he did, which was really strange, he ran up to Benny and was like, oh, hi. Oh, hi. And I thought, oh, wow, in this crazy secret way, he's also friends with Benny. He wanted to come home. And when he got home, he thought, okay, this is my home. And that was really lovely. I definitely think that he now accepts that I'm his mum and this is his home. which is great.
Almost there.
In Sydney, Audrey and vet nurse Bree are on their way to check up on one of their very special little patients.
Look at my little boy. Hi, baby. Hi. You look very bright. Hi, Tiki.
2 weeks ago, cat lover Zarima rescued a 4-week-old kitten after he was found by the side of a road with a shocking deformity.
We'll go check you out. Do you want to come into the van and I'll have a good look at him in there?
I don't know if Mum had left him behind or someone would have just, unfortunately, maybe just dumped him. Because he did have a really big swelling on the left side of his stomach, and the swelling was actually almost as big as him.
Oh, baby. He has grown.
He's grown half.
Because I remember I fit him in my whole hand before.
Honestly, as soon as I took him to the hospital, they did tell me that there was no chance, and the kindest thing to do would be to let him go.
Okay.
And then I thought, no, I wanted to hear from Audrey. And of course, straight away, she was in there and she's like, no, we're going to do everything we can for him. We're going to give the surgery a go and see if he can pull through.
Without emergency surgery, the little kitten's chances were slim.
We're really, really worried because he's got this big swelling inside his thigh, and we're quite concerned that it's a hernia and some of his bladder has come through and his small intestine. So we have to have a look, see if we can pop it all back in and hopefully give him a fighting chance.
Everything just looks massive in this baby. I actually didn't think he was going to make it at all. Initially, we thought he maybe had a small tear in his abdominal muscles, and that's where all the organs were herniating through. Once we went inside, it was a completely different story. We actually found he had not much muscle on one side, and the muscle had completely torn away from the wall. So it was a pretty big surgery, but we got there in the end.
Now it's time to find out if the surgery has worked.
The good news is all his hernia repair, so that muscle repair that we did on his abdominal wall, that's all stayed because I can feel that's intact. And there's no, intestines or bladder coming through like before. But that fluid's coming from somewhere, we need to find out where.
The kitten appears to be recovering well from the surgery, but there's a new problem.
And we've been monitoring this for the last 2 weeks and noticed that there is a bit of fluid. Not sure where it's coming from, but I'm really worried it may be the first surgery not working out, or is there something else that's happening? We tested it the other day and it did come back very suspicious as urine. So if there's a small tear in the bladder, and it would be small because it builds up over a couple of weeks, we've got to go in and repair it, yeah. It's always a little bit of a blow, when you've done this big surgery and they've been recovering so well and then you hit this hiccup. But I think, the main aim is trying to find out what's going on and fix it as soon as we can.
Auntie Audrey and Auntie Bree are going to look after you.
We're going to look after you, okay? Zarima is a really nice girl. She rescues all these kittens and spends her own money, repairing them and making them better. So I think maybe she's called him little boy because she doesn't want to get too attached, but she's completely in love with him.
I come across so many animals that need help, or especially cats. There's so many stray cats and they don't speak, they don't have a voice. So we need to do it for them, and I want to give him a good life.
Hey mate, how you going? My name's Gerardo.
On the Gold Coast, Gerardo has a little patient with a big problem.
Bowie is a 4-month-old cavoodle that's been brought down by his owner because Bowie was chewing on a chicken wing and decided to eat the whole thing in one go.
He had it and the kids were chasing him and he swallowed it.
Oh, okay. Sometimes when they're big like that, they can go past the throat, but they're not quite make it to the stomach.
Yeah.
So we'll check Bowie out, make sure he's comfy, and then we'll come back through and have a chat as to sort of the plan and stuff. Is that okay?
Yep.
Owner Nick bought the puppy for his 2 young children.
Gave Bowie like a little chicken wing and he was outside eating it, and then he ran inside and started eating it inside, so we were like trying to get him and the kids were chasing him around. And usually I can trade him with something, so if he's got a pair of your undies I can get like a fluffy toy and do a trade. But yeah, he didn't give me that opportunity with the chicken wing. It was obviously very precious to him.
You thought that they were going to come and take it off you, so you're like, no, it's my chicken wing. Nice and two hands, look at your mouth. No, little razor teeth. No, okay. okay, it's definitely not the back of his mouth. So my concern is that if it hasn't made it all the way down to the stomach, it's stuck in his esophagus, and that can cause some pretty significant trauma. The chicken wing is about this big, and Bowie is about this big. So there's a possibility there that it may not have made it all the way down into his stomach. Your daddy did the right thing bringing you down so quick.
If the chicken wing is stuck in Bowie's esophagus, Gerardo fears it could puncture his food pipe, and that could be fatal.
Good boy, Bowie.
Nick has been waiting anxiously to find out if the much-loved family pet is going to be okay.
Big concern is that if it hasn't gone all the way down, it means it's stuck in his esophagus in his chest.
Yep.
And because of the size of it, if it stretches out the esophagus, it can cause pressure, and the pressure can actually cause a hole in the esophagus, and then it's deadly.
Nick and his family recently suffered the loss of a family pet, so to lose Bowie would be devastating.
We had another little dog and she recently died, so my daughter loves animals, so we sort of had to get another dog.
And how's Bowie with the kids?
Oh, really good, yeah. Oh, he's a bit bitey in the puppy stage at the moment, so he's mischievous. He steals everything, runs away with it, which is what he was doing with his chicken wing.
Okay, so what we need to do is take an x-ray, see where it is.
Yep.
The best outcome here is it's in the stomach.
Okay.
Because it's a raw bone.
Okay, it'll break down.
It will break down. It may take a while, but it should break down.
Okay.
If the chicken wing is lodged inside Bowie's esophagus, it could actually rupture the esophagus. And that is bad, bad news. Good boy.
Be a brave boy. Lawson was very brave. You're dying to come out, don't you?
In Sydney, Audrey is about to investigate a worrying leak from rescue kitten little boy's abdomen.
Oh no. You don't want to come out.
I was feeling nervous and a little bit emotional before because, you know, just seeing how much Mum loves him and, you know, how much he's been through and him being so little. But now I think I'm on that role of let's find out what's going on, let's get him better.
The 4-week-old kitten has already undergone major surgery to repair a nasty hernia.
So we're just going to do some plain x-rays first. I just want to see how everything's sitting in the abdomen since the last big surgery.
Audrey's concerned there's still something seriously wrong with the tiny kitten.
X-rays. There's too much fluid in there.
So much fluid.
To have urine floating around in the abdomen means that there's a tear somewhere or there's some sort of leakage coming from his urinary tract. Whether it's his bladder or the tubes coming in and out of the bladder, we just don't know. So because he's so tiny, he's so young, his body condition, you know, he's very small, the anaesthetic is always risky. So we just got to watch him closely, try and make it as safe as we can. So I've popped an anaesthetic tube in, and that just makes sure that we can keep his depth under control. And then once I'm happy with how he's going, I'm actually going to catheterize his penis into his bladder and start injecting some dye to have a look. It's like threading a needle but harder because they've got this little bend, so you've got to maneuver it really gently, and then obviously everything's minuscule size. So what I want to see is that dye filling up the bladder wall and just see if it's leaking out from anywhere. I hope that there's an obvious tear in the bladder and we can go in and repair it.
That's flowing, it's flowing, it's flowing.
X-rays, and as we take more and more X-rays, I'm feeling even more concerned because I'm not seeing what I want to see. I actually want to see a tear in the bladder because I know I can go in and I know I can fix that today, but it's filling nicely, there aren't any leakages, so now I'm even more confused. I'm going to say let's inject another 0.2. I'm going to inject half first.
Yep. Oh no.
So I look up in the monitor and I can see his heart's dropping and it's dropping really low, and I go into panic mode. We need to stop everything we're doing and try and get that heart rate back up again.
Oh, now you're awake. It's right, just a bit of a stretch.
On the Gold Coast, Gerardo is about to x-ray 4-month-old cavoodle Bowie to try to locate a dangerously sharp chicken bone.
You're just so cute. We're gonna go take that x-ray now, hey? And make sure that chicken bone's in your stomach. What we need to do is find out where the chicken wing is, whether or not it's gone all the way down in the stomach or is stuck in his esophagus. Let's have a look, hey? Fingers crossed it's in your stomach.
Gerardo is worried that if the bone hasn't moved into Bowie's stomach, it could tear his esophagus, which would be fatal.
Quick lie on your side. Oh, what a brave boy.
Okay, step out.
Oh, I thought I was gonna get it. I thought I was gonna get it.
Did I get it? Did I get it?
Little Bowie is restless and it may have affected the x-ray.
That's a beautifully terrible x-ray.
Gerardo now needs to attempt a second x-ray with the frisky pup.
It's okay. Good. Just good to stay still for like 3 seconds. 1, 2, 3, and that would have been enough. Here we go. TV, Bowie, 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 Bowie. Gentle, gentle, gentle. We've definitely got that. Here we go. Success. I've taken an x-ray of Bowie's stomach and chest. Thankfully, the chicken bones are in his stomach. Look at the size of that chicken bone. That's huge.
Oh no, would he cried when he swallowed it?
Yeah. High five.
Gerardo is now hoping the chicken wing will dissolve in Bowie's stomach.
Yeah, it's really good news.
However, the little puppy isn't out of danger yet.
There's a possibility there that the bones may get stuck in his intestine or cause a perforation. That is concerning. Hopefully, it should pass through.
So excited. I can't wait.
Danny's on the road today meeting with a friend who has a special relationship with animals.
Down, please. Charlotte, you're a good pig.
Lauren trains animals to perform in movies and TV shows.
You do the big one.
Hey Lauren, how are you?
Hi, Danny, I'm good. How are you?
Yeah, good, thanks. This is our little patient today. You are so cute, darling.
Lauren's called Danny today because one of her on-screen stars, Larry, has developed a problem with his eye.
So aside from the eyes, is there any other concerns?
I was just looking at his nails thinking that they need to be done.
Oh, do they?
Yeah.
Oh, I think we can get that sorted. Well, let's go have a little look at your mate.
Great.
Hey? So if you look under the conjunctiva under there, it's a little bit inflamed. So there's no squinting or anything going on. I think for now, we could just try some antihistamine eye drops.
Danny's done a full eye checkup on Larry. He will get started on eye drops and has to be given the all clear to return to work.
All right, let's clip those nails, sweetie pie. Sorry, yes, we've got to. Has Larry been in any films lately?
Yeah, he just finished on a big one last week. He was on it for a few weeks,
Little
actually.
superstar.
Yeah.
All right.
As well as starring in movies, Lauren's menagerie of animal actors also play another important new role.
Oh, there we go. Good job.
Lauren recently started an animal therapy program for special needs children.
We've actually got a few sessions today if you want to hang around and watch.
I'd love to. Oh my goodness,
Fantastic.
that'd be wonderful.
Yes.
Oh, gorgeous. I've heard so much about them, so I'm really excited. All right, I think your nails are all done there, mate. Yay! Yay! Mwah. All done. All done. You were very good.
I'm going to inject half first.
Yep. Oh no.
In Sydney, Audrey's patient little boy is suddenly in trouble.
No, I'm just giving him atropine to try and get his heart rate up again. Oh, baby. It's going up. It's going up. The heart rate's going up slowly.
Just keep the oxygen on though.
Bit of a scare. Baby anesthetic, it's always scary. Whenever you're doing an anesthetic and you're concentrating on what you have to do and then there's an anesthetic complication, there's a lot of pressure because you're trying to do the procedure, you're trying to get the anesthetic stable, and at the back of my mind, I'm just seeing Zarima, you know, really holding on to little boy, and he means everything to her. So there's so much pressure in an emergency situation.
Little boy is finally stable, but the x-rays haven't revealed the cause of the worrying leak in his abdomen. So Audrey now wants him to get specialist treatment.
Hello.
Look who's here.
Hello.
He's pooing already.
It's time to tell anxious owner Zarima that her precious kitten's future is still uncertain.
The bladder does fill up with contrast, or the stain that we put in, and I can see the nice balloon of the bladder, and I can actually see, you know, the tube where it comes out through his penis. I can see all of that looks great. There's no leakages there. So then the question's coming, where is it coming from?
I honestly don't know what to think. We were hoping it would be perhaps a tear in the bladder or something that we could repair, but at the moment, there's a big question mark. We don't know. That's kind of what I was afraid of.
I love you. Oh, chicken. What are we going to do with you?
Can you smell it? Can you smell it? Come on, chicken. You're going to make sure you can eat some food properly.
On the Gold Coast, Gerardo is trying to coax cavoodle pup Bowie to eat some chicken, but this time, no bones.
Don't like the chicken. First dog on earth who doesn't like the chicken.
After the earlier scare with a chicken wing, Bowie seems reluctant to try the cooked meat.
Bowie was eating a chicken wing and swallowed it whole and yelped in the process. And he's not a very big boy. Okay, ready? Hey, look at this. Nom nom nom. I'm gonna eat it. Look at, I'm gonna eat it. Nom nom. Nom nom. Nom 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 nom. I ate it. It's safe.
Gerardo tries an unusual tactic.
Oh, come on, come on. Good boy, good boy. Nom nom nom. Good boy.
And it works. Before Bowie can head home, Gerardo needs to have an important chat with owner Nick.
So this is an X-ray of the side view of Bowie. This is his chest. And then this is his stomach.
Yeah.
And then this is the chicken bones.
Yeah.
You can see they're like huge.
Yeah.
Yeah.
Stomach, massive.
That's gonna sit in there for a while.
Okay.
But it should slowly break down. One concern is that it could obstruct a piece of intestine.
Yep.
And then he may require surgery, or if it actually perforates, if it sticks through the actual stomach wall or something, then that's an issue as well. But, you know, it's a fair chance that it'll pass through, and I think it's worth giving it a go.
Okay.
If you can monitor them closely.
Yep.
I explained to Nick that now that the bones are inside Bowie's stomach, the likelihood is that those bones will get broken down by the stomach acids. Here you go, mate. Oh, I'm so glad I was able to give Nick this news, because they've only had Bowie for a couple months and they love him dearly.
Awesome. Thanks a lot for your help.
That's all right, no problem. You take care, Bowie.
There you go. Yeah.
It's turned out to be an extra special day for Danny.
Oh, darlings. They say never work with animals or children. They couldn't be more wrong.
Yay! Good job, Chandler.
Danny called to check on the health of one of her friend Lauren's animal actors, and she's been invited to stay on and join in on an animal therapy session for special needs children.
How do you find the animals make you feel when you're around them? Yeah?
And my heart is full of love for them.
Oh, that's a lovely thing to say. Something about animals, I think. Yeah.
Are you ready for Romulus?
Yeah. Hello.
Ooh, it's your friend.
Oh, that's the sweetest thing in the world.
Liam's been coming here every week. Not a lot of people would find this a calming activity, but Liam does.
What is it that you love about Romulus so much, Liam?
He's such a big bird, but he's so friendly.
I think he trusts you too.
Oh.
Oh no. Nope. Nope. I think he's got his favourite.
Oh, good job, Liam.
Watching Romulus and Liam together, the bond they seem to have, and this connection and understanding of each other, and the calm that came upon them both, it's truly miraculous. I think you're number one, Liam.
The animals, to me, have always created magic, so to then be able to see it go on to these children, there are no words. Oh, well done, Tanner.
Nice. Woo!
Well done. Good job, Danny.
Tanner, you are way too quick. This is a lot harder than you make it look. I'm so embarrassed. Oh my goodness. Do you have a favourite animal?
Probably dogs and reptiles, because I love them since childhood, so they've always kind of been there and I've always loved them. Yeah, very therapeutic.
I want to come hang out here every week too.
Who wouldn't?
I know, exactly. Good job, you guys. Well done, both of you. Most of my life is devoted to the care of animals and looking after their health and well-being. It really is nice to be reminded that animals truly do have the power to heal us. Thank you so much for such a rewarding day. It was just beautiful.
Oh, thank you for coming. The kids loved having you.
Pleasure. Oh, well, I've got to get going, little Larry. Let me know how you go with his
Yeah,
eyes,
I will.
okay?
I will, absolutely.
All
Thank
right,
you.
See you later, guys. Bye. Say bye.
Hi, Zarima.
Oh, hello.
Hi, I'm Andrew.
Nice to meet you.
Lovely to meet you.
Hello.
This is little boy.
It is.
Hello, little boy. Hey, kitty cat. What's oh hello? Ow! You got me already.
Zarima and little boy have now arrived at the Small Animal Specialist Hospital for a consult with surgeon Andrew Marchevsky.
He's quite bright, and in a way, just if a cat's got all this urine in his tummy, he really should be much sicker. I guess the possibility is because it's been there for literally half his life. Maybe he's just thinking, well, that's my life. Oh, hello.
Oh.
Yeah, and that's my life, and okay, and they get on. So you might have adapted to it. You know, an ultrasound is a really easy way to have a look inside. Don't need to anaesthetise him, don't need to sedate him, and if we see some fluid, we can get a sample.
I'm definitely happy that he's in your care
Great.
and he's in everyone's care.
Yeah.
And I think he can feel that too because he won't stop purring and playing, and I think he likes all of you because he knows that you're going to help him.
I don't think you'll get anywhere near the nurses because I'm going to carry you around because I can put you in my pocket.
Yeah, that's true.
Yeah.
Thank you.
Talk to you soon.
Thank you, Andrew.
Cheers.
Bye-bye.
Bye-bye. Come on, little boy. Where are you going? We'll get you sorted. I guess what we're trying to find out with little boy is, has he still got fluid in his tummy? And if he has, what that fluid is. Because if it's urine, he's in a heap of trouble.
You can't imagine anyone living life having fluid constantly building up in their abdomen all over. So I am scared.
There's some urine in it.
A little bit of urine, yeah. Oh, little boy. You're a real wiggle puss. Do you think that's an amount you'd be able to sample?
But as little boy's ultrasound gets underway, the results are not what anyone was expecting.
You're okay. So have you seen anything with the left kidney that looks concerning?
No.
At SASH, Andrew is investigating whether kitten little boy has a leak in his abdomen.
I'm looking at this ultrasound and the first thing that strikes me is there's not a huge amount of fluid in there. I don't think there's much going on, and the bits that I can see of his kidneys, they look okay, so it's really kind of exciting. I think really from my point of view it's just there's no fluid there, which considering what it was a few days ago is great. So given what we're seeing on the ultrasound, he might actually be okay, and I don't think he's going to need surgery.
Hello.
How you going? Come on inside and we'll have a chat.
Hi.
So, first and foremost, the ultrasound showed there is no fluid in there.
Any more?
None. It's gone. It's gone.
It's gone?
It's gone. Gone.
Really? All
Yeah,
of it's gone?
Yeah, it's all gone. He'd had a major trauma and it had been there a while and was just all irritated and the fluid was building up. And now with the, tincture of time and TLC, it's gone.
I cannot believe it because so many times I've been told, it's time to say goodbye.
Oh.
Everything's gonna be okay? The moment I got him, I knew I could never let you go. That's why you have to make it through. And he showed us that he wants to. Good people have looked after you. Yes? He's so full of life.
Bunny, come this way. Bunny, here.
Back at the emergency hospital, Gerardo's next patient is blue heeler Bundy. The 1-year-old has been rushed in, suspected of eating deadly rat bait.
You gotta let me come a bit closer, hey? I know. He's a little bit nervous. Come on, mate. Bundy was brought down by his owner because she found him chewing on a block of rat bait. It's okay. Come on. Rat bait is highly toxic and deadly to dogs. If a toxic dose is ingested, the blood stops clotting, which can lead to bleeding and potentially death.
It's okay. It's okay.
The rat bait was stored in a backyard shed, and by the time owner Jess found Bundy, he'd shredded the packet.
I actually googled a little bit to see how severe rat bait could be to a dog, so I didn't really know. I went up to my neighbour and I was like, oh my god, what do I do? And she's like, take him to the vet. Bunny absolutely means the world to me. I'd be really lost without him. I would not even consider on getting another dog after him. He's just my life.
Nice and slow. Lung sounds are okay, heart sounds fine. Just go on the other side.
Although Bundy isn't showing any obvious signs of ill health, the deadly toxin from the rat bait could be already spreading throughout his body.
Have a look at your gums, mate. Nice and pink. Ooh, good boy. No evidence of bleeding or anything like that there. Check the other side, nice and pink. What we can do now is rub a tablet on Bundy's gum, and that tablet will make him feel sick. We need to make Bundy vomit to try to get rid of as much rat bait as possible. Good boy.
Hey, that wasn't that bad, was it? That wasn't that bad. That wasn't that bad.
Fingers crossed, he brings up all the rat bait.
It's okay.
Good boy.
Good.
It's a busy day for Audrey and Alison.
We're here.
They're heading out of town to one of their favourite animal shelters, the Possumwood Wildlife Sanctuary.
All right, let's get ready. See how he stands on it really well now?
After a quick checkup on baby wallaby Buzz,
Yeah, he actually hops on it very well. Oh my goodness. Buzzy.
Can you sense we've got some new visitors?
they're about to de-sex a group of rescued dingoes waiting with their protective carer, Charlie.
Hi Charlie, how are you?
Good day.
Oh, your little friends. Who do we have here?
This is Matisse,
Hi,
one of our
Matisse.
little rescue dingo puppies.
He's one of the three boys.
One of the three brothers.
De-sexing today.
That's it. And Ada, yes.
Charlie is the founder of the Sydney Fox and Dingo Rescue.
Hey, sweet boy.
So they are wild dogs. So how did they end up in care with you?
So these guys were found in a mining site. So the mining company had accidentally unearthed a den and the parents had left and were nowhere in the area and the pups were very, very young. Luckily, one of the workers actually took them home with her and got in touch with us and bottle fed them and looked after them. They are considered a pest in a lot of areas and they're hunted pretty ruthlessly. We get a lot of orphans because of baiting, and also up in Queensland, they're still allowed to use things like strychnine and arsenic, which is horrendous.
Once rescued, dingoes are not legally allowed to return to the wild, despite being native to Australia.
Obviously, all our dingoes are desexed, which is why we've got our dingoes here today being neutered, because they can't go back to the wild, and there are far too many dingoes in captivity and far too few homes for those dingoes to go to.
Who's going to go first?
Maybe Ada.
Yeah, if we start with Ada, and then we do the boys.
Our girl.
Our gorgeous old girl.
Very calm, actually.
Yeah. She's an absolute sweetheart, aren't you, Ada?
Unlike the male pups, Ada is a victim of the dingo pet trade.
So Ada was actually dumped. She was left on a lady's porch, tied up, no microchip, not desexed, in pretty poor body condition.
She's lost her incisors at the top. Was she locked in a cage or something where she was chewing down?
It's quite possible.
Chewing on chains, they just completely grind it down.
We get asked to take multiple ex-pet dingoes every week that can no longer kind of be taken care of by their former owners. People who've seen a cute fluffy puppy and thought that they would be like having a normal domestic dog, and obviously they're quite different and quite unique. I mean, they are essentially wildlife.
I'm just pressing there on her trachea and it's causing a lot of reaction. That would make me worried it might be something like kennel cough.
Okay, yeah, sure.
Which is easy enough to pick up. You do have to be careful with being around
with
the lung.
the other little ones, yes.
So we are concerned about the cough today because it could be contagious and infectious, so it could potentially spread to the other dingoes, any unvaccinated puppies.
We might delay her surgery.
Yep.
Only because the anaesthetic, because the anaesthetic is a bit stressful on their respiratory airways.
Yeah, for sure.
So we'll pop her on some antibiotics for 2 weeks.
Yep.
And then I probably will check in with you.
Yeah, cool.
And then schedule her for desexing next time. Yeah.
Awesome.
Here we go.
On the Gold Coast, Gerardo is urgently trying to save Blue Heeler Bundy
Hey, Bundy, this is your tray, mate.
after the young dog was found with an empty packet of deadly rat bait. Bundy's been given a tablet to induce vomiting that will hopefully prevent any deadly toxin from quickly spreading through his body.
He'll start to slow down soon, hey? The way we know whether or not dogs have eaten rat bait is that when it comes up, it's bright green.
Good boy. Okay.
Hey.
Good boy.
Within minutes, Bundy reacts.
Good boy. Good boy.
Bundy, you ate the green stuff. Oh, you're not supposed to eat that stuff. I can see immediately that he has had a huge dose, more than enough for it to cause toxicity. We don't know how much has already gone through his stomach, so we might start him on the antidote as well, because there's probably enough absorbed already that could cause toxicity.
Owner Jess is anxiously waiting to find out if her best mate is going to be okay.
I don't know what life would be like without him. It'd honestly be lonely. Watch TV and he's always up on your lap. So yeah, I'd be really lost without him.
Okay, that's right. It's good that it all came up, hey?
Before Bundy can be reunited with Jess, Gerardo is giving him an injection to help relieve the nausea.
It's a bit scary. It's all a bit slow. You're good to go home now. You've got some tablets to go home with. What I'm going to do is send Bundy home with the antidote, which is vitamin K. That should protect him against any toxin that he may have absorbed already. Who's in there? Hey, hey, hey. I love it how you're scratching his back, because I just found out that that's where he likes getting scratched.
Yeah, loves it.
So he's had an injection of the anti-nausea medication, so he's fine to go home. And he can have some food when he goes home too, and have that tablet.
Yeah.
She's going to continue giving Bundy the vitamin K for the next 4 weeks. If Jess didn't bring him down, it's very likely that he would develop a severe bleeding disorder in about 3 to 4 days. So this is a great outcome for Bundy. Okay.
Thank you so much for your help.
That's all right.
Just pressing there on her trachea and it's causing a lot of reaction. That would make me worried it might be something like kennel cough. You do have to be careful with being around
With
the lung.
the other little ones, yes.
At the Possumwood Wildlife Sanctuary, Audrey and Alison are about to desex 3 male dingoes.
All right, first one up the rank, Matisse.
Matisse, you've been moved up the rank because Ada's not going in. All right, let's get your weight. 13 kilos.
Well, it's our first time ever treating or doing surgery on just dingoes, pure dingoes, and I think they're pretty cute.
They're
very active. They're really active, they jump around a lot, but really lovable.
All right, little needle.
Sleepy time. Oh, he is a bit cute, isn't he?
I like him when he's sleepy.
Can we just cuddle him all day?
We would have thought that we'd actually be sitting here with a dingo today in our wildlife hospital.
The journeys we have gone.
The pre-med's working.
So desexing Matisse is going to be like desexing any other male dog that we do in the clinic. It's just one skin incision where we get both testicles out, so we actually leave the scrotum in place.
Okay, all done. Let's stitch him up. He's all done, so ready for the next one.
While Audrey and Alison move into desexing their next patient,
Nothing going on, just vibration.
rescuer Charlie helps watch over the recovering dingo.
All right, little one.
Hey, Lucky lost.
So we're all done. We've done Banksy, Rembrandt, Matisse, and Ada. High five.
So we come out into the waiting room just to check on all the dogs that we've desexed today. And there's one more patient left, the lovable Ernie.
So Ernie was poisoned by 1080 bait up in Queensland, so he actually started having seizures. He aspirated and got pneumonia in one lung.
Gosh, okay.
And
That was during the seizure?
During the seizure. He's just had a rough ride, haven't you, Ernie?
Ernie was left with serious complications from the poisoning. He was rushed to Specialist Animal Hospital Sash for life-saving treatment.
Because he was feeling so unwell, he wasn't eating, which is why he's lost quite a bit of weight and had to have the feeding tube placed.
How old is he?
So he's about 5 months old, we think, but
younger than these guys.
Yeah. So you can see the difference it's made to his poor little body. So he's got a long way to go.
All right, let's get him into surgery. I might need a hand with him because he's a little bit scared. Ernie's pretty sad. I mean, he looks really sore. He looks quite, upset. So we're just checking in on him today, checking his gastric tube, make sure that he's recovering well.
Yeah, he feels a bit warm. I don't know. I think I'm just so paranoid about everything now that I'm like, we just check his temperature.
Anything indwelling is always a higher chance of infection, so you want to make sure that we keep infection away.
That's looking a little bit better, little man.
Yes, I know. All right, baby.
Okay.
That was it. We're not going to touch you anymore. You've been through too much, okay?
Done. You're done.
Done. Send you and your friends home. There we go.
They are amazing animals, but they're not a typical pet, and they do belong in the wild. They are part of our wildlife. I would love for it to be possible for wildlife carers to release dingoes back into the wild. I would like to see better protections for them and a more compassionate way of coexisting with these fairly essential animals that really deserve that kind of recognition as the native animals that they are.
Any opportunity to come and visit an animal shelter, just give some advice or help out is a good day. So today is a really good day. Here we are.
In Melbourne, Danny's calling into an animal shelter that has special meaning for her.
Save a Dog holds a very special place in my heart because it's where my husband and I adopted our first dog, Willow, and she was such a special soul. She was quite traumatised when we first got her, and seeing her come out of her shell and become a happy dog again was the most fulfilling thing in the world.
Danny's meeting up with shelter owner Pam.
Hi Pam, how are you?
Danny, how are you today?
Good to see you.
Thanks for coming.
Oh, pleasure. How have you been? Been busy since I was here last?
Yes, very as usual.
Oh, I bet. So Pam, how long has it been now since you opened Save a Dog Scheme?
Oh, nearly 36 years.
Isn't that incredible? You are just a Wonder Woman, my goodness.
No, we had a lot of help. There's been a lot of wonderful people who've helped me.
Absolutely. Oh, hello.
Hello, Moses.
This is Moses. Hello, aren't you gorgeous?
Yes, he is. He's lovely.
Oh, thank you.
But today, it's not a social visit. Danny's here to check up on rescue dog Gumnut.
Hello, darling Gumnut. Hi.
Very trusting little soul once she gets to know you.
Shelter General Manager Margie has been caring for Gumnut after the little rescue dog had to have most of her teeth removed.
We'll have a good look at that mouth and make sure everything's all healed up nicely today.
Excellent, thank you.
Let's have a little looky here. It's got the front teeth there. We've got a couple little premolars down the bottom there. Well, other than those teeth, I think you look like you're in pretty good shape, darling, considering your age too. Now we just need to find a loving home for you, little darling. Okay. In the 36 years you've been doing this, how many animals have you saved?
Well, many, many thousands, maybe about 40.
40,000. Feeding time over the years must have been an enormous challenge with all of those animals.
Yes, it is. Quite chaotic at times.
I bet.
We now have this amazing device,
Oh.
which has made it a lot easier.
Oh, really? Fantastic.
Yes. Would you like to have a look at it?
I would.
So, Danny, this is what we've been using.
Oh, I know this device. This is fantastic for portion control. And then every dog gets exactly what they need.
You know about it. Would you like to do the honours?
Oh, well, why not? joy, mate. Oh, Moses, you're so beautiful. Oh, I'd love to take him home.
We can provide about another 40.
Oh, well, let's take him all home.
Yes, I'll bring the car around.
Okay.
Oh gosh, such good news. I can't wait to see you.
3 days later, Audrey is checking up on her miracle patient.
Do you know all the heartbreak you've been causing everybody?
So little boy looks completely happy and normal today. He's running around. You wouldn't even know all the trauma that he's been through.
And your hair's growing back.
Look at that. Gosh, his belly is back to normal. I think little boy is the luckiest cat that ever lived. He's got Zarima, who loves him to death, would do anything to help him, you know, get through this. And I think it's because of all her love and tender loving care that he's actually pulled through. And I think he's come to the right place.
Yay! I just think all the tears and all the pain and the sleepless nights, I'm like, did that actually happen? Because he's presenting like completely fine now. It's unbelievable.
And the chicken wing that Bowie gobbled down fully dissolved with no ill effects. Chicken bones are now off the menu for the mischievous little pup.